We do apologize to all members of the public that did anticipate the board's meeting being convened this morning. There will be an opportunity to comment on all of the items under the Communication and Public Education Committee later this afternoon. Chairperson Sanchez, did you have any closing remarks, or are there any comments from council?
No, I just apologize to those on our committee. Unfortunately, things come up and members aren't able to make it. It would be best if we wait for the full board to do a better presentation of members, and we can take action on some of the issues that we've recommending. And thank you for your patience and the full board meeting.
And this is Eileen. I don't have any comments. This is up to the chair's discretion, and no further comments from legal.
So I've got to have more part.
I apologize for the interruption. This is Anne. Sure. Chairperson Sanchez, we're having a hard time hearing you. Your audio is moving in and out. Thank you.
Okay, can you hear me better now? Anne, can you hear me better now?
At the start of the sentence, we can hear you, and then it kind of trails off a little bit.
Let me see if I can figure out why. Anyways, we'll reconvene with this report, or we'll finish it during the full board meeting. Thank you. Were you able to hear me?
Yes, so we will ask the meeting moderator to go ahead and end the meeting. Thank you all again for attending. We apologize for the last minute cancellation, and we look forward to your participation later this afternoon. Thank you.
All right, this is the moderator, and I will be closing the WebEx. Please join us for the board meeting later this afternoon at 12:30. Thank you.
October 27, 28, 2021 board meeting. My name is Sang-Oh, president of the board. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 2 minutes to each individual providing comments. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions. Moderator?
Hello, this is the moderator. To facilitate public comment today, we will be utilizing the WebEx question and answer feature. When the board president reaches a point in the agenda at which public comment is appropriate, public comment will be requested at the board's direction. I will turn on and announce the opening of the Q&A feature. Members of the public can indicate that they would like to make a comment by clicking on that icon with a question mark within a square located at the bottom right-hand corner of their WebEx screen. And the instructions will be shared on the screen each time for your reference. In the Ask field, typically in the lower right-hand corner of your WebEx screen, members of the public who wish to make a public comment will type, "I would like to make a public comment," or "comment," and send to all panelists. Any other communication will not be responded to. Members of the public, it is not necessary to identify yourselves in order to make a public comment, and we will take comments in the order that they are received. I will call on that member of the public and request to unmute their microphone, and that member of the public will have 2 minutes to speak with a 10-second warning, and at the conclusion, their microphone will be muted, and we will move on to our next individual who has requested public comment. Please note that the Q&A feature is only being used as a means for members of the public to represent that they would like to make a verbal comment. Once you are unmuted, that member of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. If you do not have a microphone, please click that audio and video icon up at the top of your WebEx screen and select switch audio and then follow the prompts in order to call in. If you need further assistance, please refer to that How to Join DCA WebEx event guide that was provided with the board meeting link. And at this point, I will pass it back over to our board president.
Thank you, moderator. I would now like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Maria Serpa. Thank you, Maria. Maria's here. Jig Patel.
Here.
Hi, Jig. Thank you. Cheryl Butler.
Here.
Hi, Cheryl. Cheryl's here. Jose de la Paz. Jose is not here today. Shirley Kim. Shirley is not here today. Ricardo Sanchez.
Here.
Hi, Ricardo. Thank you. Nicole Thibault. Hi, Nicole. Thank you. Debbie Veal.
Here.
Hi, Debbie. Thank you. Jason Wise.
Here.
Hi, Jason. Thank you. And I'm here. The quorum has been established. Members, we have a full agenda for our meeting over the next 2 days. I truly appreciate all of your time and commitment to the board and California consumers. I ask everyone participating today to be respectful of the work before the board today. I will now ask the moderator to open the line for individuals to provide public comment. You're not required to identify yourself, but may do so. As we open the lines, I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the board and public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Moderator?
All right, this is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a public comment for items not on the agenda, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen and type comment or I would like to make a comment and then send to all panelists. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
I see on the chat, there's a comment. I'm maybe having some technical challenges on there.
I apologize. WebEx has been opening the chat function automatically when I turn it off. I'm gonna try to turn that back off again because it should not be open. Okay, is the chat function closed now?
Yes, but
Okay.
I think they probably didn't get to click on the Q&A. So
Yeah, I'll leave the Q&A open.
Yep. Okay. Let's just give them some time.
All right, it appears we do have one request for public comment. One moment while I get the my timer open. Individual identified as Stephen Gray. Stephen, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. All right, and you are unmuted.
Thank you very much for the opportunity to comment. I would like to place on the future agenda a further discussion of a part of AB 1533. AB 1533 in Section 20 modified Bmp Code 4129. It says basically there that an outsourcing facility can also dispense patient-specific medication, but it also says it must comply with the same requirements of a pharmacy. I've gotten calls already. This bill goes into effect January 1. It's not clear what it means by it has to comply with the same requirements of a pharmacy, even though it's not licensed as a pharmacy. For an example, does it have to have a PIC? Does it have to employ a pharmacist to dispense the medication? If non-licensed persons help with that dispensing, do they have to be pharmacy technicians? Who is responsible, if there isn't a pharmacist there, with doing the consultation that is required when you dispense a medication? All of those questions are laid open. There are outsourcing facilities that want to move forward, as of January 1, January 2nd, with this, because they have patients that need these patient-specific medications. So I believe that in maybe December 2nd, there is an opportunity, if this is not resolved today during the Enforcement Committee report, it should be fully discussed by all of the board as to just exactly what that phrase in 4129 means when the pharmacy can dispense patient-specific. Notice that I said dispense, it doesn't say distribute, which is what usually happens if it were to send it to another pharmacy to give to the patient. Please put that on the agenda. Thank you.
All right, this is the moderator, and we'll move on to our next individual who has requested public comment. Individual identified as Corey Hawks. Corey, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. All right, and you are unmuted.
Thank you so much for allowing me the time to speak. I just wanted to echo the previous caller's comments. We would like to discuss 503B outsourcing facilities and would ask the board to further discuss the dispensing requirements for 503Bs. So just to echo that, I won't take the full 2 minutes, but we have reached out to the board on various occasions asking about dispensing requirements for 503Bs in the state of California and had not yet heard, and it's probably subject to this December 2nd ruling, but we would also ask the board to discuss that topic. Thank you so much.
All right, this is the moderator, and it appears that was our last individual who has requested public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you.
Mr. President, I have a comment.
Go ahead, Miss Vice President Serfa.
Just to let everyone know, before making a decision about adding to the agenda, this item is on today's agenda during the Enforcement Committee report.
Okay, that sounds good. So with that, having received public comment, anyone would like to include any item on a future agenda, please remember to state your name before speaking. Okay, hearing none, looks like it is covered. Okay, moving on to the next agenda item, agenda item 3, approval of board meeting minutes. Included in the meeting materials are draft minutes from the July 28th, 29, 2021, September 3rd, 2021, and September 23rd, 2021 board meetings. As we begin, I will first ask for questions or comments on the draft minutes from the July 28, 29, 2021 meeting. When you speak, please remember to identify yourself, and also I'll entertain a motion to approve the minutes. Members, anyone willing to make a motion to approve or any comments?
Oh, this is Debbie Veal. I would be happy to make a motion to approve the minutes of July 28th to 29th, 2021 as presented.
Thank you, Ms. Veal.
This is Ricardo. I'll second that.
Thank you, Ms. Ricardo. Any other comments? All right, hearing none, with a motion and second, I will open the discussion for public comment on the July 28, 29, 2021 draft minutes. Moderator, please open the lines for public comment.
Moderator, and at the direction of the board, I have once again opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. It looks like we do have one individual has requested public comment. Individual identified as Mark Johnston. And Mark, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. All right, and you are unmuted.
Hello, Mr. President. I wanted to make a comment during the last period. However, the Q&A function briefly flashed on my screen. You had alluded to a technical problem, which I definitely experienced on my side, and I would still enjoy the opportunity to speak to a topic that's not on the agenda.
Okay, yeah, let's make sure that's okay with the council. Eileen, do we just need to reverse back to the previous agenda item? I am more than happy to give Mr. Johnson an opportunity to comment, if that's okay.
It's up to you, President O. We can take the comment and then open it up for public comment again, just to the minutes. But if this gentleman had trouble accessing the Q&A feature and you want to give him that opportunity now, it's entirely permissible to do so.
Sounds good. Okay. All right. Thank you, Eileen. Go ahead, Mr. Johnson. And if there were any other stakeholders that were having technical difficulties, please also put it on the Q&A right now so that we will be able to hear. And we apologize for the technical difficulties. Go ahead, Mr. Johnson.
Well, thank you so much. At the 10/27/20 meeting nearly a year ago, I presented this issue, and if we go back to that meeting and look at the recording, about 20 minutes in, the board decided not to agendize the issue because they thought that Ann and I could form a resolution outside of a board meeting. It's been a year, and we've been unable to form a resolution. The issue is surrounding HIV furnishing, and CVS Health and their 1,200 pharmacies in California are not currently participating because of this issue. The issue is that the furnishing statutes in 4052 require adherence with CDC guidelines, and CDC guidelines require pharmacists to order tests more than just a negative HIV test. Tests such as baseline values like renal function tests, liver function tests, etc. Because the statute didn't contemplate this circular trap that we're within, we went to 4052A11 to look at a pharmacist's ability to order these tests, and it's limited to ordering tests to evaluate toxicities of therapy. So next we went to the advanced practice pharmacist ordering capabilities, and that statute allows an advanced practice pharmacist who are willing to hire to provide this service the ability to order the test, but only if they are related to drug therapy. And we're asking the board if they can interpret that tests in lieu of potential furnishing are related to drug therapy so that we can order these tests and service these patients in California. If you can't interpret, perhaps a statute change is something to consider. Thank you very much. I'd appreciate if this was agendized on a future agenda.
Thank you, Mr. Johnson. Go ahead.
All right. This is the moderator. I believe that is our last individual has requested public comment for items not on the agenda.
I believe so, yes. I think Mr. Stein is just saying that there was technical difficulties. Okay, so with that comment, members, I'm going to go back and just survey if anyone would like to recommend to add to the future agenda. Any topics for future?
This is Debbie Veal, Chair of the Licensing Committee.
Yes, Ms. Veal.
It is my intent to agendize a post-implementation review of SB 159, which I believe is what Mr. Johnson is referring to. so that we can determine if there are any changes that are needed to, or whatever other items that might be appropriate, kind of as a debrief of how SB 159 is working. So, we have a kind of a draft agenda for our list is long, I guess is what I'm trying to say, but it will be something that we will be putting on a future agenda. We also kind of want to make sure that pharmacies have had a chance to implement SB 159, but please know that it will be on a future licensing committee agenda. And the executive officer actually did speak with me. I think what the board had indicated to Mr. Johnson was that the executive officer would work with him, and if, whatever kind of came out of that conversation, if appropriate, she would come to me. And so she did come to me. And so we, so I asked that this be put on our list for a future agenda item. So sorry, I'm a little bit tongue-tied here, but that is our.
Okay, thank you, Ms. Field. So I'm guessing that means we have that already on a future agenda, potentially?
That it will be on a future agenda.
Okay.
I can't tell you which agenda, but
Okay.
It will be on a future agenda.
Okay, thank you, Ms. Field. And with that, members, anyone would like to still add anything to the agenda? Okay, hearing none. I am sorry, everybody, we're jumping around. We're gonna go back up now to the motion that was on the table, with Debbie being the motion and Ricardo being the second. And now we're opening again the public comment for the July 28, 29, 2021 board meeting minutes. Moderator, please open the line for this specific item.
All right, this is the moderator. Members of the public, if you would like to make a comment for the board meeting minutes, please click that Q&A icon that's located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. With a motion and second and public comment received, I will now take a roll call vote. As a reminder, please open your line before voting. Maria Serpa? Thank you, Maria. Maria votes yes. Jig Patel?
Yes.
Jig votes yes. Thank you, Jig. Cheryl Butler?
Yes.
Thank you, Cheryl. Cheryl votes yes. Jose is not here. Shirley is not here. Ricardo Sanchez? Thank you, Ricardo. Ricardo votes yes. Nicole Tebow?
Yes.
Thank you, Nicole. Nicole votes yes. Debbie Veal?
Yes.
Thank you, Debbie. Debbie votes yes. Jason Wise? Thank you, Jason. Jason votes yes, and I vote yes. The motion passes. The next draft minutes for our consideration are from the September 3rd, 2021 meeting. Please, members, if you have any comments on this specific meeting minutes, as well as if anyone would be willing to make a motion to approve the September 3rd, 2021 meeting. Moderator, if you could advance the slide to the next. Thank you. If anyone would be willing to make a motion to approve this minutes or any comments.
I'll make a motion. This is Jig to approve September 3rd, 2021 emergency board meeting minutes.
And this
Thank
is
you, Jig.
Cheryl Butler. This is Cheryl Butler. I second.
Thank you, Cheryl. Jig motion. Cheryl seconds. Anyone have any comments? All right, hearing none with a motion and second, and we're going to open up for the public comment. Moderator, please open the lines for public comment.
Moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. With a motion and second and public comment received, we're going to take a vote. We're going to start with Maria again. Maria Serpa.
Yes.
Thank you, Maria. Jake Patel. Thank you, Jake. Cheryl Butler.
Yes.
Thank you, Cheryl. Ricardo Sanchez. Thank you, Ricardo. Nicole Thibault.
Yes.
Thank you, Nicole. Debbie Veal. Thank you, Debbie. Jason Wise.
Yes.
Thank you, Jason. And I vote yes, the motion passes. And the last draft minutes for our consideration are from the September 23rd, 2021 meeting. Members, when you speak, please remember to identify yourself prior to making your comments. I will also entertain a motion to approve the minutes for September 23rd, 2021 board meeting. Anyone would like to make a motion, please?
This is Cheryl Butler. I'll make the motion to approve the meeting minutes for September 23rd, 2021.
Thank you, Cheryl. Anyone?
And this is Nicole, and I second.
Thank you, Nicole. Appreciate it. With a motion and second, we're going to open up the line for public comment. Moderator, please open the lines as appropriate.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. With a motion and second and public comment received, I will now take a roll call vote. Again, Maria Serpa.
Yes.
Thank you, Maria. Jig Patel.
Yes.
Thank you, Jake. Cheryl Butler.
Yes.
Thank you, Cheryl. Ricardo Sanchez.
Yes.
Thank you, Ricardo. Nicole Thibault.
Yes.
Thank you, Nicole. Debbie Veal. Thank you, Debbie. Jason Wise.
Yes.
Thank you, Jason. And I vote yes, the motion passes. All right, moving on to the agenda item 4, update from the Department of Consumer Affairs. Members, I would now like to welcome Brianna Miller, manager with the DCA's Board and Bureau Relations Office, to provide the board with an update from the Department of Consumer Affairs. Ms. Miller, welcome and thank you. The floor is yours.
Just want to first make sure that everyone can hear me okay. Sometimes I hear my headset can come in pretty soft, so just
we can hear you, Ms. Miller.
Great, thank you. All right, then I'll move on to my update. Good afternoon. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me an opportunity to provide the department update to your board today. First, I'd like to talk a little bit about COVID-19 safety measures and telework. DCA appreciates all board members, committee members, and staff who have continued to serve through a pandemic that has affected all of us in many ways. We're working together to find the right balance of staying connected and productive while keeping healthy and safe. DCA and its boards and bureaus continue to look to the future and use lessons learned to identify long-term efficiencies and policy changes. Staff are working in the office to provide the most effective consumer protection and public service while also utilizing telework where appropriate. DCA is assembling a task force to help the department create a telework policy that will provide further clarity and structure for managers and staff, and is expected to be finalized next fall. Next, I'd like to discuss testing and vaccination verification. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or be subject to regular COVID-19 testing. DCA's testing program kicked off in early October, and the launch of the DCA Headquarters 1 location's pilot site. Select programs have been designated to test at Headquarters 1, and that list of programs recently expanded due to the capabilities of the site. Other sites will begin testing at a later date to be determined. Board and committee members must follow health and safety protocols if they plan to visit a DCA location or attend an in-person meeting. Members must verify vaccination or follow testing protocols in accordance with that location's requirements. Please communicate any plans for in-person meetings as soon as possible so DCA can assist with coordination of teleconference options for the public, vaccination verification, and COVID-19 testing. Next, I'll discuss remote meetings. DCA recognizes the difficulty of planning for future meetings as the pandemic continues to. As the law stands today, remote meetings are allowed until January 30th, 2022, after which time meetings will need to be in person in accordance with all aspects of the Open Meetings Act. We don't know what additional changes to the law may be coming, but I think we all recognize there are benefits to remote meeting options, such as increased public participation, cost savings, and a lower carbon footprint due to reduced travel. DCA encourages boards and bureaus to continue utilizing remote meetings this year to protect the health of staff, board members, and the public. And we will keep you updated on any additional changes to meeting requirements. Moving on to a note about appointments and recruitment. Whether meeting remote or in person, DCA wants to help keep your board fully seated with excellent members and diverse voices. Currently, the board has 3 vacancies, 2 public members and a licensee member who is a long-term care or skilled nursing representative, all appointed by the governor. DCA's communications team has been working on a new communications toolkit to assist boards with member recruitment, which will be available in multiple languages before the end of the year. In the meantime, please encourage individuals who are interested in serving as a board member to visit the Board Member Resources Center on DCA's homepage to apply for an appointment. And next, I'll discuss scam alerts. DCA has been made aware of various scams affecting boards and bureaus. We have shared information about these scams on the DCA website and social media. Please take a moment to visit the DCA Fraud Alert website, which you can find by going to DCA's website, dca.ca.gov, to learn about these scams and how you can protect yourself from malicious individuals. And finally, I'd like to provide you with a reminder about required board member trainings and the learning management system. As a reminder, 2021 is a mandatory sexual harassment prevention training year. This means all employees and board members are required to complete the training during this year, which is rapidly approaching its end. Board members will now access the training through the Learning Management System, or LMS for short, which is DCA's training portal. We have created profiles for each of you in the LMS and informed your executive officer of the steps you will need to take to log in and access the training. Board and Bureau Relations is also happy to assist you with any questions or concerns you may have about using LMS. And so that concludes my presentation. As always, Board and Bureau Relations is here to help. And if there's anything we can do to assist your board, please do not hesitate to reach out. And with that, I will hand it back over to President O. Thank you very much for your time.
Thank you very much, Ms. Miller. Members, do you have any questions or comments for Ms. Miller?
President O, this is Debbie Veal. I have one comment. I have one question actually for Ms. Miller.
Go ahead, Ms. Veal.
Ms. Miller, you mentioned January 30th, 2022 is when there could be a change in board meetings to possibly open it up. And then you also said that, protect the members and the public, that I think you also said that perhaps the department is also encouraging, or I'm not sure what the word was you said, to continuing, I think, WebEx meetings. Could you just kind of expand upon those 2 comments? I'm trying to kind of adjudicate them in my brain.
Sure. I'm sure, and I welcome legal counsel's assistance as well, discerning what the legislation, I believe it was AB 361, what it allows for flexibility with the Open Meetings Act. But that legislation allowed for us to continue remote meetings until January 30th, 2022. Certainly, with things with the pandemic being fluid, there could be additional legislation, executive orders, what may be, I'm just, brainstorming right now, but there could be other changes down the line. So we're acknowledging that things are fluid, and that was where we mentioned that we'll keep all boards apprised of any changes to meeting requirements as soon as they come up. But in the meantime, DCA does encourage remote meetings where if boards desire to do so, in order to protect the public, as mentioned, just maintaining health and safety of board members, the public, and staff.
Okay, thank you. That answered, that clarified.
Oh, great. Thank you.
Thank you. Thank you, Ms. Field. Thanks, Ms. Miller. Any other member questions or comments? Okay, moderator, we're going to open the line for public comment for Ms. Miller.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. And thank you again, Ms. Miller, for coming to our meeting to give us updates.
It was a pleasure. Thank you all.
Thank you. We're going to move on to the agenda item 5, Enforcement Committee Report. I will turn the floor over to Maria Serpa, Chairperson for the Enforcement and Compounding Committee, to provide a report on behalf of the committee. Maria, floor is yours.
On behalf of the Enforcement and Compounding Committee, I'm happy to provide the report from the committee meeting last week. First is discussion and consideration of enrolled or recently signed legislation impacting the practice of pharmacy. Members, a significant portion of our meeting was dedicated to the discussion of recently signed legislation impacting the practice of pharmacy. As I begin my report, I note that the meeting materials include a summary of each bill, along with a brief description of the efforts that will be undertaken to implement the new provisions. The first bill to discuss is AB 107. This first measure relates to veterans and military spouses. This measure will require the board to issue temporary license to practice within 30 days of the board's receiving the results of fingerprint background check. The measure does not require an applicant for a pharmacy license to take, the measure does require the applicant to take the pharmacist, let me repeat that just to be clear. The measure does require an applicant for a pharmacist license to take and pass CPGAE as a precursor to issuance of a temporary license. As indicated in the meeting materials, the provisions will take effect July 1st, 2023. This will provide the board time to complete the necessary implementation activities. Some of the activities are in the meeting materials and relate to application and instruction updates, changes, and changes to the data systems. During our meeting, members indicated that it was appropriate for the licensing committee to develop regulations necessary to implement these provisions. Debbie Beal is a member of our committee as well as the chair of the licensing committee. Debbie agreed that the development of regulations is appropriate for the licensing committee. Our committee did not receive any public comment on this measure. Member, do you have any comments on AB 107?
Maria, the only comment I have is, this is Debbie Veal, is a comment that I made during our committee meeting was, at first pass, it almost sounds like a new pharmacist applicant, like maybe a recent grad who happens to be a veteran or a military spouse, could potentially practice in California with only passing the CPJE. However, I believe that during our discussion that was filtered out, that the expectation is that this would be people who have licenses perhaps in another state. And it's just to enable them to more quickly be able to practice in California.
That is correct. That was determined to be in the bill as licensed in another regulated area.
That's
so that
correct.
would be something that would be detailed specifically in the regulations that we're hoping that the licensing committee would come up with for us. But that was a good question, Debbie. Any other comments from members before we go to public comment? Okay, let's go to public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests.
I don't see any public comment.
Yes, it appears there are no requests for public comment. Would you like me to close the Q&A feature?
Please do, thank you. Our next bill is Assembly Bill 527. Just need to change the screen here. Thank you. AB 527 includes the board-sponsored provision to exempt specified non-narcotic combination product controlled substances from the California Controlled Substances. I note that the implementation efforts should be minimal and will include education on the change. We received no public comment during the committee meeting. Members, do you have any comments? Seeing none, I think we're ready for public comment.
This is the moderator. At the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you have a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access that Q&A panel and submit their requests.
Don't see any public comment.
All right, would you like me to close the Q&A feature?
Thank you. Our next bill is Assembly Bill 1064. This bill expands authority to allow pharmacists to independently initiate and administer any vaccine that has been approved or authorized by the FDA and received a recommendation by the Advisory Committee on Immunization Practices. Like the last measure, implementation efforts will focus primarily on education of the change. During the committee meeting, we received public comment from the California Pharmacists Association, thanking the board for its support of the bill and noted the expanded role for pharmacists under the proposal. Members, do you have any comments? Hearing none, let's go to public comment.
This is the moderator. At the direction of the board, I have once again opened up the Q&A feature for public comment. Members of the public, if you have a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests. So would you like me to close that Q&A panel?
Thank you, please do. Our next bill is AB 1533. This is our sunset bill. It contains a number of changes in pharmacy law. There is specific information in the meeting materials for the several impacted sections. Similar to the process that I used during the committee meeting, we will review one section at a time, followed by member comment. We'll reserve public comment until after we complete our discussion of the entire bill. Members, do you have any questions on this process? Okay, let's start. There's quite a few sections to go through. First, the measure extends the operations of the board until January 1st, 2026. Committee members agreed with staff recommendation to review the sunset information on an annual basis. Members, do you have any comments before we move on to the next section? Okay, the next section amends 4052 to expand authority to pharmacists to initiate, adjust, or discontinue drug therapy for a patient under a collaborative practice agreement and also expands the authority for pharmacists to provide medication-assisted treatment pursuant to a state protocol. Implementation efforts will include the board's development of a state protocol to facilitate implementation of MAT authority. As part of our discussion, Debbie Veal agreed that it was appropriate for the licensing committee to work on a state protocol. Members also noted that changes to expanded collaborative practice is the best interest for consumers. Members, do you have any questions or comments? Okay, the next section of this bill is section 4052.6. This was amended to expand the authority for an advanced practice pharmacist to initiate, adjust, or discontinue drug therapy beyond healthcare facilities. Implementation efforts will focus primarily on education about the provision and should reiterate the provision for I'm tongue-tied here. It should reiterate the provision for coordinating for care and education with the diagnosing prescriber. Members, any comments? The next section is 4110 and 4126.10, where changes were sought to implement the provisions of the FDA MOU addressing certain distributions of compounded drugs. Specifically, pharmacy license renewal will require notification of compounding practices for pharmacists distributing compounded human products, as well as reporting requirements established in the MOU. Implementation efforts will include updating renewal forms, data systems, as well as developing educational materials. During our committee meeting, members did not have any comments. However, we did receive public comment. Public comment suggested that the provisions of the MOU could potentially be delayed beyond October 2022, and it may be appropriate to consider exercising enforcement discretion relating to the reporting requirements. I do not believe that any action is necessary at this time other than the implementation efforts detailed in the meeting materials. Members or council, do you have any comments or questions?
This is Eileen. I don't have any comments or questions, Dr. Serpa.
Thank you. Members, any comments? Okay, next section. This was a section that was brought up during public comment, so please pay attention to this part. Pharmacy law was also amended to allow outsourcing facilities licensed by the board to dispense patient-specific compounded drug preparations under specified conditions, including that such dispensing shall comply with the same requirements of a pharmacy. Implementation efforts will include development of educational materials. It is anticipated that extensive education to outsourcing facilities will be required. Our committee agrees with the information in the meeting materials that indicate that education is necessary to allow harmony with federal allowances while assuring patients have access to pharmacist care, including drug utilization review, patient-centered labeling, and patient consultation requirements. Members, do you have any comments? And just to remind everybody, this was a section that was discussed or questioned during public comment at the beginning of the meeting. So I'm sure we'll have some public comment at the end of this bill regarding this section. Members, are you okay with us moving on? I take your quiet. Thank you. Next is section 4161. This was amended to create alternative pathways to licensure for non-resident third-party logistic providers. Implementation efforts will include updating application instructions and forms. As mentioned in the meeting materials, staff will also need to begin working with facilities who've been granted temporary licenses to assure those entities currently under the board's waiver process for distributing ventilators and vaccines into California. This work will need to be completed prior to the expiration date of the temporary license to assure continuity, to the effective date of this new law, which is January 1st, 2022. Members, do you have any comments? The next section is 4210. This alters application requirements for an advanced practice pharmacist recognition to allow for qualification under a single pathway, if that pathway includes completion of a second criterion. This clarifies the requirements and eliminates the current confusing language. Implementation efforts will include updating application instructions and forms, as well as development of educational materials. In addition, staff will be reviewing pending applications to determine if the changes in the requirements will impact applicant eligibility. Any comments or questions? Next is Bmp Code 4232.5. This was amended to require a pharmacist with the authority to prescribe a controlled substance to complete an educational course on the risks of addiction to Schedule II drugs. Implementation efforts will include updating the renewal application requirements via regulation. The regulation will give notice of the requirement and how an individual will demonstrate compliance. As a committee, we determined that the licensing committee is well suited to complete this work and noted that the evaluation should also include areas related to CE requirements as well. Members, any comments? Great. Under the provisions of this bill, and that's our sunset bill, the board will be required to convene a working group of interested stakeholders to discuss whether moving to a standard of care model is feasible and appropriate. As included in the measure, the board will be required to submit a report of recommendations to the legislature by July 1st, 2023, following the completion of the work group. I note that the board's president has the authority to establish an ad hoc committee, which the enforcement committee believes is appropriate for this work. During the meeting, during our committee meeting, President O, who is a member of our committee, noted that the education on the standard of care will be provided in January, and board members will be provided with an opportunity to participate on the ad hoc committee that will be created. Members, do you have any questions? Moving on. Under the provisions established in section 4317.5, the board will have new fine authority to address repeated violations under specified conditions, including that the violations occurred in community chain pharmacies operated under common ownership. This measure provides for an opportunity for the pharmacy to cure a violation as long as the violation does not result in actual harm to any consumer or pose serious potential harm to the public. Implementation will include education about the provisions. The enforcement committee will also be provided with data on the implementation efforts of this new fine, and will include it as part of our annual presentation received on the board's citation and fine program. Members, any comments or questions? Getting to the home stretch. The last section on this bill, which is our sunset bill, is section 4427.65, which expands the location where unit dose automated drug delivery systems may be located. As with several changes we've indicated above, which as we've just discussed, implementation will include education on the provisions. Members, do you have any comments on this section? Okay, so that's the end of Assembly Bill 1533. So now I would like to ask the moderator to open the lines for public comment on any of those sections.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Looks like we do have at least one request for public comment from Danny Martinez. You'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. All right, and you are unmuted.
This is Danny Martinez with the California Pharmacists Association. So to go back to the MOU portion of this bill, and just for context for the rest of the board, 4126.10 subsection A specifically states a pharmacy located in California may distribute compounded human drug preparations interstate only if all of the following conditions are met. And it goes into the conditions, the first one being between January 1st and March 31st of each year, the pharmacy reports all required data for the previous calendar year into the information sharing network established by NABP in conjunction with the FDA to implement the MOU addressing distributions of compounded human drug products. It was confirmed at this committee meeting that the board has not yet entered into the MOU. This section was specifically written into this bill specifically for addressing the MOU. And I'm concerned right now that because the MOU has not been signed, starting the first of the year, this language as written essentially does not allow pharmacies to distribute compounded human drug preparations interstate, because right now there is no signed MOU. There's no ability to submit this information to NABP. And so that's why I had initially asked for at least a delay in implementation or delay in enforcement until the state, or rather the board, has decided to sign the MOU. So I just wanted to provide that context for our concern and ask that you do consider that. Thank you.
Thank you, Mr. Martinez. I believe you brought that up also during the committee meeting, and that's why the board, why the committee is recommending that we consider exercising enforcement discretion relating to the reporting requirements at this time. Any other public comment?
Yes, one moment. Looks like we have another request from Stephen Gray. And Stephen, you'll be given 2 minutes to speak and a 10-second warning. I'll request to unmute your microphone now. All right, and you are unmuted.
Thank you very much. First, I'd like to reemphasize the importance of a timely decisions on the 4129. The law goes into effect January 1. Outpatients who need services from outsourcing facilities need that right away. I suggest you put it on the December agenda of the board to make those decisions before the law goes into effect. Second, regarding the requirement for Schedule II controlled substance education, there is nothing in the statute that requires that to be renewed on a biennial basis. And it would be important for the board to give direction again, even though it doesn't go into effect till July 1, 2022, schools now could go ahead and produce the educational course requirement so that graduates next year who under 4052 changes will be able to do collaborative practice agreement and get their DEA numbers, could go ahead and provide that service if the board agrees that education courses provided by the schools during this spring would satisfy the requirement. And also, I think that's it for right now. Thank you.
Thank you, Dr. Gray. I do have a question for council or for Ann regarding process and Dr. Gray's comments. At the committee, when we discussed this, our discussion was to move forward on educational materials. Do we need another meeting to discuss those educational materials, or is that something that staff could put out urgently to assist with educating members of the licensed public and our other outsourcers with this new law? Where do we go from here? Do we actually need another meeting, or are the materials in process?
So I believe that the board staff will be developing educational materials if the board would like to see them. and approve them, we can certainly add them to a future agenda item if that's the preference. If the board prefers not to have the full board, but believes that one board member should review and approve, we can certainly run that through the chair of the Enforcement and Compounding Committee or the board president or someone else as the board feels is appropriate.
So we should include that in our motion at the end? Or?
I'm not quite sure that a motion would be necessary. I think that the minutes memorializing the board's preference for direction would be sufficient, but I'm happy to defer to council.
Okay. After
I would, I think you can express what your preference is without a formal.
Okay. After public comment, I'll make a comment then. Are there any other public comments?
This is the moderator. We have one more request for public comment. Corey Hawks. Corey, you'll be given 2 minutes to speak in a 10-second warning. Request to unmute your microphone now. All right, you are unmuted.
Thank you so much. I appreciate that. As was discussed in this 1533 bill, it says under this bill in section 6, in lieu of that prohibition, an outsourcing facility licensed by the board dispensing patient-specific compounded preparations pursuant to a prescription for an individual patient would not be required to be licensed as a pharmacy. Although this does address the licensing aspect, we would request that the board further discuss outsourcing facilities under the DQSA Act that added that unlike compounders operating under Section 503A, outsourcing facilities are subject to CGMP requirements, and that they may distribute compounded drugs either pursuant to a patient-specific prescription or, and this is what I would ask the board, or in response to a health or to an order from a healthcare provider for office stock. So I would, in addition to this licensing element, we would request that the board discuss dispensing and office stock for 503Bs. Thank you.
Okay, that's going to get a little bit complicated there. The member of the public, I'm sorry, I forgot her name, brought up something that is not agendized and not part of this bill. So I don't think we can discuss that part of it. Eileen, is that correct?
That's correct. It's not agendized, but as we're developing educational materials, we can always address issues that we believe are called for, in trying to implement this new authority for outsourcing facilities.
Right. So long as we limit it to the authority granted to us by the law, from what I understand from the public comment, it goes beyond the extent of the law and would be a new topic. So that would be something that would be as a new topic regarding office use. But I think, or do we have any other public comment before I make a recommendation or I reiterate the committee's recommendation?
This is the moderator. It appears there are no more requests. Would you like me to close that Q&A feature?
Please do. After hearing public comment, members, I just would like to reiterate the recommendation of the committee, and that is to develop extensive educational materials to provide information to licensees and to the outsourcing facilities as to what this new law entails. Typically, that's something that's done by staff. I would be happy to review that information if staff or the members think that that would be appropriate, but typically the staff put out educational materials without our review also. So the committee's recommendation is to just put out the educational materials. And members, do you have any other comments, or can we move ahead with that committee suggestion? It's not a motion, it's not a vote, it's just what the committee recommends.
Maria, this is Song.
Any other comments? Okay, thank you. We're going to move on to the next bill. So we do have several remaining bills that were enrolled or recently signed impacting the practice of pharmacy. The next one is SB 306. Under the provisions, a pharmacist will be allowed to dispense medications without an individual's name if the prescription includes expedited partner therapy or EPT. It will also require a pharmacist to provide a written notice that describes the right of an individual receiving EPT to consult with a pharmacist about the therapy and potential drug interactions. Implementation efforts will focus on education on the measure. Members, do you have any comments? Okay, let's open up for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests.
I don't see any.
All right, would you like me to close the Q&A?
Please do, thank you. Okay, thank you everyone for your patience. We're moving on to Senate Bill 310. This creates a medication collection and distribution program that allows for patients to donate previously dispensed medications back to a participating practitioner or physician for redistribution to other patients of the same practitioner. Under the provisions of the measure, the board has the authority to request records to evaluate for compliance with the provisions and has the authority to prohibit a practitioner from participating in this program under specified conditions. Implementation will focus on education about the provisions as well as extensive education of identified board staff to assure practitioners have appropriate policies and procedures, documentation of drug manufacturing requirements, and to assure appropriate patient protections exist. Data on this new program will be collected and reported to our committee. Members, do you have any comments? Okay, let's open for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. It looks like we do have one individual who's requested public comment. Stephen Gray, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now.
We don't hear you, Dr. Gray. Are you speaking?
Yes. Now.
Okay.
Thank you very much. I noticed that, yes, there's a lot of education that has to be provided, not only to pharmacy people and maybe the general public, but also to the, quote, participating practitioners. And the implementation didn't mention also that those practitioners, which is limited to, I believe, 50 practitioners in the state, apparently, will need to register with the board of pharmacy. If that's correct, I think that needs to, have some comments about how staff is going to do that, how they decide which practitioners get to participate. Is it first come, first serve? Is it equally distributed across the state? Or are there provisions to address underserved areas? All of those things, I think, are anticipated with the passage of this legislation. Thank you.
Thank you, Dr. Gray.
Dr. Serpa, I apologize for the interruption. I'd just like to clarify for the committee that the requirements for managing the registration and participation by the physicians or prescribers does not actually reside with the board. That resides with an intermediary as established in the legislation. So I just wanted to clarify.
Thank you, Ms. Silvergren. I think we're ready to move on to the next bill, Senate Bill 311. There it is. This measure requires healthcare facilities to allow a terminally ill patient to use medical cannabis under specified conditions. Late amendments to this measure specified that healthcare facilities permitting such use must comply with drug and medication requirements applicable to Schedule 2 through 4 drugs and shall be subject to enforcement actions by the California Department of Public Health. As included in the meeting materials, the late amendments create conflicts within the measure itself. Specifically, the amendments to require medicinal cannabis to comply with provisions related to Schedule 2 through 4 medications create a number of questions about the applicability of board regulations, including storage, inventory control, acquisition, and the role of the pharmacy in these facilities. As a committee, we discussed that it is appropriate for us to determine what is the board's role in resolving these conflicts, along with other regulators and stakeholders. There are other challenges with this measure that may be outside the board's purview, but problematic for health systems, including concerns about federal implications to allow using of medical cannabis in healthcare facilities that could negatively impact their licensure, accreditation, and reimbursement. During the committee meeting, we noted that the measure does not reschedule medical cannabis. We received significant public comment on the many challenges of this bill. Public comments included discussion with the author's office that appeared to confirm that the intent of the measure was not to reschedule medical cannabis. The author clarified to interested parties that it was not their intent of the legislation to hold the pharmacy responsible, and to ensure that this was understood, the author's office is requesting a letter be published in the Senate's Daily Journal. Comments also noted that several questions were raised by the measure, including questions of acquisition, disposition, and inventory control. Further comments indicated that the provisions of federal law that prohibit the DEA from taking action against a hospital that allow the use of medical cannabis. As a committee, we have requested that staff report back to us with recommendations on how to communicate and educate on this measure. Members, do you have any comments? Hearing none, I think we're ready for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. We'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. And it looks like we do have one individual who has requested public comment, Robert Stein. You'll be given 2 minutes to speak in a 10-second warning. I am requesting to unmute your microphone now. All right, you are unmuted.
With regard to the question with respect to 1649.3, I think it was easily confused that this was potentially trying to treat cannabis as a Schedule 2 through 4 controlled substance. But that's actually not what it says, and I think we've already heard that's not what was intended. What was intended is you've got a Schedule 1 drug now that you're allowing patients to use and control, but that doesn't exempt you from all the other controlled substance laws regarding Schedules 2 through 4. I just wanted to clarify that. Thanks.
Thank you, Dr. Stein.
All right, we have another request for public comment from Lori Hensick. You'll be given 2 minutes to speak in a 10-second warning. I will request to unmute your microphone now.
Thank you, and thank you for the opportunity to comment again. I just want to thank Board Member Serpa for leading the discussion during the committee meeting, and I wanted to, let me take a step back and introduce myself, Lori Hensick from Scripps Health. But I wanted to thank the committee for taking these steps to ask the staff for support, and also I noticed in the meeting materials asking for more of an educational approach with respect to enforcement, considering this goes into law on January 1st, and there's still a significant number of questions that need to be fleshed out with some of the conflicting laws. I think my remaining concern and really just requests of the board as they ask for staff, lean on staff for additional recommendations is to, the awareness that that this could, or the concern in terms of the impact or possible impact on individual pharmacists license. And so a pharmacist who is responsible, or even the PIC who's responsible for making sure that they are operating in accordance with all of the other regulations, including pointing out, as Dr. Stein pointed out, the requirements from 1649.3, whereby it says that the medicinal cannabis must be treated or shall comply with all of the requirements applicable to other existing requirements for scheduled drugs. I think there is some growing concern among people on what their personal licenses might be at stake due to the conflict between the different laws. And so we just really want to make sure that our pharmacists are not caught in the crosshairs because the individual author's office did not happen to realize the impact. I think much of the discussion on the impact of this bill initially was focused around the impact on a facility level, i.e. CMS funding and other facility level issues, which is why CDPH was able to or weighed in. However, CDPH, as we all know, does not license individual pharmacists, and that's the Board of Pharmacy. So I think that particular part of the discussion was not included with the author and CHA in the early design of the bill. So I really would appreciate if the board and the staff of the board would really take a look at the impact that this could have on individual pharmacists who are going to be verifying orders or handling this medication in terms of storage, and what that might do in terms of impact on their individual licensure, so that we don't put these pharmacists at jeopardy just because of oversight of the author when they were trying to enact this bill. Thank you so much.
Thank you, Dr. Hensick.
All right, this is the moderator. We'll move on to our next individual's requested public comment. Danny Martinez, you'll be given 2 minutes to speak and a 10-second warning. I'll request to unmute your microphone now.
Danny Martinez with the California Pharmacists Association. Piggybacking off of Dr. Hensick's comments that she just made, we also have grave concerns about the individual license of a pharmacist. It goes without saying that, in addition to the Board of Pharmacy, which is obviously central to being a pharmacist in California, there are also DEA and FDA and other forces at play, which I know this board does not have authority, but those are serious considerations to take. We did submit a letter of concerns. It was not an opposition letter per se, but it was a letter of concerns to the author's office at the very end of legislative session, given the very late amendments as previously discussed. So we appreciate the board's understanding that this does create a weird place, and we understand that the author didn't really mean to put it in a weird place. It's where it is now. We look forward to working together to make sure individual licenses are not put in jeopardy here. Thank you.
Thank you, Mr. Martinez.
All right, this is the moderator, and it appears that was our last request for public comment. Would you like me to close the Q&A panel?
Please do, thank you. Thank you, everyone, for your patience. We have a couple more to go. Senate Bill 362. This measure will prohibit a community chain pharmacy from using a quota to evaluate the performance of a pharmacist or a pharmacy technician. As in a committee, we noted that the implementation efforts will include education on the provisions, as well as a process for a pharmacist or a pharmacy technician to use to file a complaint. It appears that it may be appropriate to dedicate educational efforts also on whistleblower protections. As a committee, we will also receive data on the implementation of this new law. During the meeting, we received public comment from a representative of UFCW, noting that UFCW looks forward to working with the board on implementation efforts. Members, do you have any comments? I think we're ready for public comment.
All right, this is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. All right, it looks like we do have a individual's requested public comment, Rachel Stone. Rachel, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. All right, and you are unmuted.
Hello?
We can hear you.
Okay, yes, hi, sorry. I was wondering if the board has plans to fine chain pharmacies for violating this law.
Is that a question? Do you have anything else to say before we answer your question?
That was my question.
Okay, thank you for your question. I appreciate that. I think that probably best for council or Anne to answer. I don't believe that was included in the law. Anne or council, is that correct?
Yeah, this is Anne. I didn't know if Eileen wanted to jump in, so sorry. So I would say that the board in general reviews for violations of pharmacy law, right, through the investigative process, and then depending on the egregiousness, has a variety of different tools in its toolbox, if you will, on how to resolve violations, whether it's a letter of admonishment, it could be fines, it could be discipline. So when we look at any kinds of violations of pharmacy law, there's different tools. Specific to 362, I would note that there is additional, so there's a fine authority that is established in existing law, and under AB 1533, there are additional fine authorities. So I think that it will be assessed as it is for any investigation on a case-by-case basis to determine the appropriate outcome based on the findings of a violation.
Thank you.
Thank you, Ms. Sodergren, and thank you, Ms. Stone. Any other public comment?
It appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Please do, thank you. Members, this is our last bill, hooray. It is Senate Bill 409, which expands authority for pharmacists to provide CLIA-waived tests under specified conditions. Implementation will include education on the provisions. Also, the board's health service registry should be updated to include these additional patient care services. We did not receive any public comment on this bill during our committee hearing. Members, do you have any comment? Let's open for public comment. Oh, and we need to change the slide, sorry, 409. Thank you. Public comment?
All right, this is the moderator, and I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests.
I don't see any.
All right, would you like me to close the Q&A?
Please do, thank you.
Okay.
President O, is it okay to continue? I think the rest of it should not take too long, or would you prefer to take a break?
I think I will leave it up to the members. I'm okay, but if anyone needs a quick break, we can take a quick break.
Maria, I remember from the committee meeting, it's like 5 or 10 minutes left, right?
Yeah, it should go very fast.
Yeah, I would vote we just wait until the end.
All right, that sounds great. Let's just keep on chugging along. Thank you, Maria.
Okay.
Go ahead.
Thank you. Our next item is discussion and consideration of revised proposed changes to USP chapters and the board's current policy statement. As we transition to compounding matters, the first item for us to discuss is the recent release of revised proposed changes to USP chapters and the board's current policy statement. Relevant law sections are detailed in the meeting materials, so I won't cover them all, except to note that under section 4127, the board is required to review any formal revisions to USP chapter 797 no later than 90 days after the revisions become official to determine whether amendments are necessary for board's regulation. As we learned during the 2019 committee meetings with many stakeholders, we actually we had many meetings with stakeholders to update the current pharmacy regulations. Review and consideration of USP chapters require significant amounts of member time. The work was put on hold when USP paused their implementation date to look at additional changes in their proposed language. Given that with the release of newly revised proposed changes to the chapters, our committee noted it is appropriate for us to resume our work on updating compounding regulations. Members, I draw your attention to a high-level comparison chart on USP chapters 795 and 797 in the meeting materials that was prepared by staff. I'd like to thank those staff members who provided these charts for us. It is really helpful in reviewing the details of the changing chapter documentation. This will be easier for us to compare the previously suggested regulation changes in addition to USP chapter updates. As a committee, we turned our focus to review the board's current policy statement, noting that it was important to update the policy statement with new information and to communicate this information to licensees. Next steps for our committee will be to monitor the USP process in finalizing the standards and restarting stakeholder meetings on compounding in 2022. So having provided a summary of our discussion, I'd now like to draw your attention to the draft policy statement that was included in the meeting materials, and it should be displayed on the slide coming up. It's really small wording, but the slide should be coming up momentarily. This is in your meeting materials also. This is an updated policy statement to include new information since USP has recently released their information. So the committee is offering a recommendation related to this policy statement. But before we consider the policy statement, I wanted to open up discussion to the members. Members, do you have any comments before we make a motion?
Maria, this is Debbie Veal. I'd like to just ask that, I know I asked during the committee meeting if you could kind of point out what changed from our prior, and I believe what you said is it's basically, I think it's the last two paragraphs have been added, and that might be helpful for people kind of just jumping in here.
Yes, if you were to compare this policy statement with the previous one, it updates the date. So it says in light of September 1st, 2021 release of USP chapter, and it goes through and talks about what USP has done recently, updating the information there. It reiterates what the board's current process is for sterile compounding and current laws and regulations. And then it talks about where our process is going forward and that we will be looking at moving forward in resuming discussion of compounding information. So it basically updates the old policy statement with the new information from USP and reiterates the board's position. No change to the board's position. Thank you, Debbie. Any other comments from members? Okay. President O, the committee is recommending to the board approval of the draft policy statement. I will note that the committee did not receive any public comment on this motion during our meeting. Since this is a committee motion, we do not need a second, but we're ready for a public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Please do, thank you. Mr. President, we're ready for the vote.
Thank you, Chair Serpa. Okay, voting on the motion for the policy statement. We're gonna start with you, Ms. Serpa. Dr. Serpa, go ahead.
Yes.
Thank you, Dr. Serpa. Ms. Jig Patel. Thank you, Jake. Cheryl Butler?
Yes.
Thank you, Cheryl. Ricardo Sanchez? Ricardo? Nicole Tebow? Oh, thank you, Ricardo. Nicole Tebow? Thank you, Nicole. Debbie Beal?
Yes.
Thank you, Debbie. Jason Wise? Thank you, Jason. And I vote yes, the motion passes. Back to you, Chair Serpa.
Thank you. The next item on the agenda is updates on FDA actions related to human compounding. Awesome. Thank you. Included in the meeting materials are 2 items for information only. They're included not only for the board's information, but to inform stakeholders. The first item relates to the notice of extension of release by the FDA relating to the MOU on interstate distribution of compounded drug products. Included in the notice, the FDA is extending the period for a state to enter into the MOU until October 27th, 2022. This extension will allow the board time to implement provisions, including those we earlier considered in Assembly Bill 1533. The second item, slide, is notice of October 7th release by the FDA of a draft guidance document titled Hospital and Health System Compounding under Section 503 of the Federal Food, Drug, and Cosmetic Act Guidance for Industry. The guidance describes how the FDA intends to apply certain provisions of Section 503A to human drug products that are compounded by state licensed pharmacies for distribution within a hospital or health system. I note that written comments must be submitted to the FDA by December 6th. During the meeting, we received comments asking about the steps necessary for the board to enter into the MOU. Council reminded everyone that the board has previously discussed the issue and the individuals interested should refer back to those prior discussions. We couldn't discuss that during the meeting because it was not agendized specifically, but it is in minutes from previous meetings. Members, do you have any comments? Let's open up for public comment.
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I will pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Please do, thank you. Our last item for the committee report was review and discussion of enforcement statistics. Attachment 2 includes the enforcement statistics for the first quarter of the fiscal year. Members, do you have any questions on any of the statistics referenced or in the chair report or in the detailed statistics in the attachment? Seeing none, let's open it for public comment.
All right, this is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of the WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests.
Okay, I don't see any.
All right, would you like me to close the Q&A panel?
Please do, thank you. Okay, Mr. President, that concludes the report of the Enforcement and Compounding Committee.
Thank you so much, Chair Serpa. We appreciate all the time and dedication for the committee as well as you. Okay, so it's 2:01. I'm going to request we take a break for about 15 minutes. So we will be back at 2:16, and we'll be back for licensing committee report. Thank you, everyone.
Oh, this is the moderator. Let me click that record button just real fast so it doesn't interrupt anyone.
Sure, go ahead.
All right, go ahead.
Thank you, moderator. Okay, everyone, we're gonna take a roll call really quick to establish a quorum again, making sure everyone's back. Maria?
Here.
Thank you, Maria. Jake? Hi, Jake. Thank you. Cheryl Butler.
Here.
Thank you, Cheryl. Ricardo Sanchez. Ricardo, you back? Okay, we're gonna go to Nicole. Nicole, are you back? Hi, Nicole. Thank you. Debbie Veal.
Hi, I'm here.
Thank you, Debbie. Jason Wise.
Here.
Thank you, Jason, and I'm here. Ricardo, are you back? Okay, Ricardo, if you could just tell us when you're back. I think we have a quorum, so we're gonna just get going. Okay, so agenda item 6, licensing committee report. I'm gonna turn over the floor to Debbie Veal, chairperson for the licensing committee, to provide a report on behalf of the committee. Debbie, floor is yours.
Thank you. So I just want to point out the committee members to licensing are myself, Song O, Cheryl Butler, Jig Patel, and Jason Wise. So at the first item I want to go over and is on the screen is discussion and consideration of the business profession codes 4071.1, the board's waiver to facilitate provisions for remote processing and consideration of possible changes in statute or regulation to establish a permanent authority under specified conditions. So hopefully you had a chance to read through the board material and you understand what our current regulation 4071.1 establishes as far as remote processing, as well as the, what it permits, or maybe better to say what it doesn't permit a pharmacy technician, because under 4038, it specifies that pharmacy technicians are wholly and exclusively permitted to practice only within a licensed pharmacy. And then just looking through kind of some of the provisions to see if there's any other I want to make sure I point out. The main thing is with the remote processing waiver, it states that the purposes of the waiver means the entering of an order or a prescription into a computer from outside of the pharmacy or hospital for a licensed pharmacy is defined in our business and profession codes. In addition, our current waiver also provides pharmacists performing remote processing may also, so in addition to what they can do, may also receive, interpret, evaluate, clarify, and approve medication orders and prescriptions, including medication orders and prescriptions for controlled substances, Schedule 2 through 5. And this waiver remote processing may also include order entry and other data entry, performing prospective DUR, interpreting clinical data, insurance processing, performing therapeutic interventions, providing drug information services, and authorizing release of medication for administration. Key to note, the waiver does not include the dispensing of a drug or final product verification by remote processing. Now, it also expanded what pharmacy technicians and interns can do. So it allowed non-discretionary tasks, including prescription or order entry, other data entry, and insurance processing, and medication orders for which supervision by a pharmacist is provided using remote supervision, using technology, and at a minimum ensures that the pharmacist is readily available to answer any questions of the technician or the intern, and also can verify the work performed by the technician or the intern. So understanding, what the waiver has provided, what the committee, what the goal of the committee was, is to look and see, is this something that, we should move from our current regulations to something that is, more permissive and allows more use of remote processing. And so the first thing I shared, and I think it's the next slide, is there's a number of states that have implemented remote processing. And so specifically, we talked about Virginia. There's others that can be talked about. I know, and the stakeholders mentioned, I think Arizona, Texas, Montana was in our materials. So there's quite a few states that have embraced remote processing provisions, and they have been in place for quite a while. Even the ones that California have been around for a number of years. So this is not a new activity. It's more, let's look at what we have and how have things changed. Let's try to kind of update our regulations perhaps because there's a lot better technology and things like that available right now than perhaps were available when our regulations are put in place. So looking at the Virginia law, some of the key things that it talks about is, provisions specifically around pharmacies. And in that regard, it's the requirement for policies and procedures and specific records so that, you still maintain some control over, what happens in that pharmacy, ability to go back and look at issues and understand exactly who did what. Let's see, that's pharmacies. Can you flip to the next one? I know this is really small print. So there's some more information here about, additional requirements about pharmacies. This is kind of more the records requirements. Can you flip to the next slide? Okay. So we then wanted to just kind of go through some just general questions to make sure that this was the right steps to take. So the very first question is, should the board at this time consider a change, basically? And, specifically around pharmacists, pharmacy technicians, and interns. And in general, we acknowledge that this is not a one meeting, let's talk about it, slap some regulations together, give it to the board and see where we go. We realize that this is going to be a process and probably go over a number of meetings. So, I want the board members and the people that are listening to this webcast to understand that we're not solving it today. And I think generally the mood of the board and the stakeholders was, yes, this is absolutely something that we need to look at. We're not sure what the answer is, but we definitely need to look at it and see where we are. The second question, if you can flip to that, was, does remote processing provide improved care for consumers? And, generally we saw some opportunities there. We also need to make sure that, one of the comments that was made is, what is there studies, like what can we look to? Has there been any, since we've had this waiver in place, has there been any issues that have come up specifically because of remote processing? There's a lot of questions about, how long has this been around? And, I think one of the stakeholders mentioned that there, to some extent, in quite a number of states, the number was thrown out with 45 states have some form of remote processing. So the next question, if we can flip to that, was what functions, I'm sorry, go back, thank you. What functions in the waiver appear appropriate to be performed and by whom? So, instead of kind of getting into that detail, we thought that was probably something that we needed more information to really understand, and also to understand if there have been any issues. Okay, moderator, if you can flip to the fourth question. If either the current waiver or other provisions are made permanent, should the pharmacist in charge be explicitly authorized to make determination if the staff are allowed to perform the remote functions, and should the remote functions be limited to electronic prescriptions only? I think generally everyone felt very much that the pharmacist in charge should be the one who would determine who and what would be would happen, that they would have that control. And then let's see, moving on to question 5, and I'm kind of going through this rather quickly because this took us, quite a bit of time. At this point, when we got to question 5, what conditions should exist? There's a number of things we discussed. One, we all felt most comfortable with the pharmacy being a pharmacy license in California. There was some concern about offshoring, but we felt like the pharmacists and perhaps the individuals would have a California license. Exactly how the board is notified is something that I think we have to kind of land on. Everybody felt very much that HIPAA breaches were a concern, but we felt like, I think the general feeling was, I don't want to say, because we really didn't come to any conclusions, but the general feeling was HIPAA was something to be concerned about, but there's a lot of other places that HIPAA breaches are already governed and have to be reported. And should the functions be limited only when the pharmacy is open? I think generally we came to the conclusion that maybe that's not that important. And we also saw this as an opportunity for the workforce to, for people to be able to work from home. And, especially right now, it seems like we are all experiencing labor issues in that there are a limited number of qualified technicians and even pharmacists, and perhaps by allowing remote processing, that would enable us to access some of that, some of those folks that maybe might be limited to their home, whether it be for physical abilities, physical disabilities, that we could access a group of people that perhaps home is the way they can. Maybe it's people who are taking who are taking care of children or whatever. But anyway, we also thought that it might also open up some opportunities to get some well-trained people in the workforce or back in the workforce. So in general, what we came to, like I said, not going to be a one meeting type of thing. And we decided that at our next meeting, we want to resume the discussion. And we specifically asked the staff to work with our council and clarify, provide clarification about existing law, because there was some comments made by the stakeholders that we really kind of wanted to vet out. And understand what really is currently allowed and what really is currently not allowed, because that's, I think, where we saw a little bit of gray going back and forth around that. And we also asked the staff to confirm or look into investigations or complaints and see if there have been any specifically as a result of our waiver, and were there any even like before we had our waiver? So, did the waiver impact it, and did the waiver cause any more problems or issues because we relaxed some of the requirements around it? Also, really look at the HIPAA notification, because like I said, we feel like HIPAA breaches need to be reported, but perhaps I think we had some stakeholders that said, that's probably not something we have to worry about because there's already requirements around HIPAA breaches. So let's make sure we understand what that is. And then also to look into a couple of the states, I know specifically Virginia and Arizona, and see if there's anything we can learn from the regulations that those two states have put in to place. And we picked Virginia specifically because it just looked like the regulations align more with our state, and Arizona was mentioned that it had remote processing for a number of years, and so we thought that would be another good one. So that's that was it. We had at least an hour discussion, if maybe longer, on this. So we did some great deep digging And like I said, I think we came out of it saying, yes, we absolutely need to be looking at this, and perhaps there is something we want to do around establishing some permanent authority in the future. But we really needed to get more information before we could make knowledgeable decisions or further discuss any of these specific questions that we had originally talked about. So with that, I'm going to open up first to my committee members. Did I miss anything that you thought was significant about this discussion that you want to highlight? Or if I summarized it well enough, that's great. We'll go on and see if any board members have questions. But committee members, I think everybody from the committee is on this call. So committee members, is there anything else you want to add?
I think you summarized it pretty well. I just wanted to mention about pharmacists' ability to be ready for any for the state's emergency preparedness. So if folks can work remotely and if there are regulations that are set around it, the infrastructure, let it be equipment or whatever else the board decides. If all of that is set, then folks could be quickly deployed to work during emergency. So that was one of the things that I wanted to bring up.
Okay, yep, I didn't touch that at all. Thank you. All right, not hearing from any of the other committee members, any of the board members have any questions or comments?
Debbie, this is Maria.
Hi, Maria.
I have a couple of comments and some background.
Yep.
Because pharmacists currently are allowed to practice pharmacy outside of a licensed pharmacy. So it has been quite some time, if not more than a decade, that pharmacists are already performing remote processes in taking care of patients. It is very, very common in acute care and probably used quite often also with DUR and other kinds of clinical reviews. But I could speak to acute care. It's a very common practice that in hospitals or in facilities that require medications be reviewed prior to administration to a patient. And that requires the pharmacist to review the medication, usually within somewhere between 10 minutes to a half hour to an hour, depending on the acuity of the patient, that those places don't have open pharmacies. So when the pharmacy is closed, they have pharmacists off-site doing remote verification or order entry. That's very common. So I just want to make sure that these discussions that now include interns and technicians do not create any unintended consequences or barriers or additional barriers to the current practice that's very common that is required for safety of our patients in the acute care environment, and also those areas where they're doing DUR and the like. As I stated, pharmacists can practice outside of a licensed pharmacy. Where I see the waiver was really intended was for interns and technicians. That was something that was brand new to them, and that's where the waiver was required.
Yeah, thank you for your comments. I know we did have a discussion and one of the stakeholders specifically brought up, let's just make sure that whatever we're doing, we aren't taking away from what we already had established. And so we are very sensitive to that. So thank you for reminding us of that.
Debbie, this is Nicole.
Hey, Nicole.
I just want to say I had never really thought about technicians, working remotely prior to the pandemic and this waiver being put into place. But seeing it really points out the opportunities that it offers to bring more patient care. When you're looking at some of our, very expensive urban areas in the state, it's pretty unlikely that you can purchase a larger pharmacy or otherwise make your pharmacy bigger. We're pretty limited by the space that exists. And at a certain point, that space is going to hit the capacity of people you can have in it. But if you can separate and put people in different physical areas outside of the pharmacy, that's really going to offer us more chances to help our patients without having to spend the kind of resources that we may not have. So just wanted to throw that out there. I think this is great. It hadn't occurred to me before, but I really appreciate that we're looking at this.
Thank you for your comments. Okay, Ms. Moderator, not hearing from any other board members, can you open up the Q&A?
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I will go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, appears we have no requests for public comment. Would you like me to close that Q&A panel?
That'd be great. Thank you so much. Okay, moving on to agenda item B, which is a discussion and consideration of a requirement to serve as a pharmacist in charge, or PIC. So I'm tongue-tied there for a second. We reviewed the provisions of the law that defines what a PIC is. And we reflected on the fact that at our strategic planning session in July, as a board, we established a strategic objective to determine if application requirements for a PIC would be appropriate to ensure sufficient knowledge, skill, and abilities for individuals seeking to serve as a PIC. And the one thing, let's see, just give me one sec here. One thing I did want to point out is what it currently says. So section 4036.5 defines a pharmacist in charge as a pharmacist proposed by a pharmacy and approved by the board as a supervisor or manager responsible for ensuring the pharmacy's compliance with all state and federal laws and regulations pertaining to the practice of pharmacy. So that's kind of really what we were focused on, is a pharmacist who's proposed by their employer and approved by the board to be the supervisor and manager. And I think, reflecting on the discussion at our strategic planning session, we felt like, that this was a good discussion. We wanted to, start it as soon as we could. We all are cognizant of situations.
Sorry for interrupting. Could you advance the slide, Ms. Moderator? Thank you.
Oh, thanks, Song.
I apologize. Are we on slide 35?
Why don't you keep going? Keep going. Keep going. Keep going. That's what we're on right there.
Thank you.
So we had, and moderator, just go one more slide. I don't know if you have these questions that we considered. If you can flip one more slide. Okay, so we had 4 questions that we talked through. You see 2 of them on the slide now. If you'll flip to the next 2. So basically, are there fundamental knowledge, skills, and abilities that are required? Should the board require a certain type of continuing education or other training? Should the board require attestation from the proposed PIC acknowledging and confirming other legal requirements for the PIC, and should there be a minimum number of hours of PIC? So I'll just kind of talk through, give you a very Reader's Digest version of kind of the discussion around each one of these. We definitely feel like there is some fundamental knowledge, skills, and abilities that are required of someone to serve, and that going into question 2, that the board it seemed very logical that the board could require some type of education, hopefully continuing education, so you get some CE along with it, but some sort of training as a precursor to assuming the role of a PIC. And we did want to, number 3 here, we did want some sort of attestation or acknowledgement of the individual becoming the PIC to make sure that they understand what this means, because we have come across situations, probably most commonly in discipline type situations, where an individual too often is like the new hire and the position that's available is the PIC, so they sign up and do it, and they don't, it seems like maybe they did not understand exactly what they're signing up for. So, we wanted this, some sort of attestation or acknowledgement that they understand, they have to sign for it, they understand what's going on. And with that, then also some sort of training class that they would take, prior to becoming a PIC, hopefully, so that they also understand, maybe where the resources are, and some of the responsibilities that they have to have. There's a lot of fantastic PICs out there, so we're not trying to say, across the board that there's a problem with PICs, but there definitely have been situations that as a board, we do come across situations where it seems like people are, in some cases, less than well equipped. If you go to question 4, that was, should there be a minimum number of hours to be a PIC? And we, so moderator, if you just flip to the next slide, we pretty much universally felt like that probably wasn't where we wanted to go. Because I think we all had come across individuals who had become the pharmacist in charge with a lot of experience, and people who had become pharmacists in charge with not a lot of experience, and it didn't always mean, the quality of the PIC necessarily went with the hours. Sometimes, yes, but not always. So with that, once again, this one had, some pretty good discussion. And with that, what the motion that the board came up with, if you can flip to the next slide, moderator. I'm sorry, not the board, the committee came up with, was to recommend to the board that the licensing committee pursue a training program for proposed PICs, as well as a requirement for an attestation as a precursor to being appointed, to be appointed a PIC. And it might be to be appointed by your employer or your pharmacy to be a PIC. But so we did embrace kind of the two of the 4 questions that we went. We did feel like it was important to make sure that everyone gets some sort of a training, 1 or 2 hours, and then all PICs would sign the attestation before we receive the request from the employer to make the person a PIC. And Anne can call out if I'm saying this wrong, but I believe, as I read before, a pharmacist in charge is a pharmacist proposed by a pharmacy and approved by the board. So the board approval is basically, just checking to make sure that their record's clear and doing a finger check for check to make sure that they're not only their board of pharmacy record is clear, but that they're, they don't have any other issues against them. So with that, committee, is there anything else that you feel like needs to be pointed out and talk about PICs? Okay, hearing none. Other board members, any comments you'd like to make or questions you'd like to ask about our discussion? And in your board material, there was some good comments from the stakeholders also. So you can read that, but I'm not going to necessarily highlight anything.
Hi, Debbie. It's Nicole. I just had a question.
Yep.
Was there any? I know it was one of the questions, but it seems like maybe you moved away from the CE question. Were there any thoughts of ways though that we could support existing PICs? Or would they be required to go through the training program as well? Like what would there be for people who are already in that position?
Nicole, that's actually a very good question. And I don't know if it was really something that we were kind of looking more at new PICs. Our training program definitely would be a CE program, and it would be required of new PICs, but current PICs absolutely could, be a CE program for anybody, but it would just be required if you're a new one. But that might be, kind of phase 2 now. Okay, maybe we talk about the new ones, and then we go back and figure out, or maybe as we're doing this, we figure out if there's something we need to require of the current ones too. Maybe the current ones, well, you don't ever have to sign, you don't have to, you only do PIC paperwork if it's a change. But if you were to change like locations, then I would think this could potentially click in. And that's probably one thing that we're going to have to consider also. But that's a very refreshing idea. Let us think about that when we discuss the if the board approves this, when we discuss the program. Thank you.
Sure. I want to throw out one idea as well. This is Nicole again. I want to throw out one idea. If you do go ahead with this, I know this is another committee, but perhaps we consider the way we do email communications. Maybe we could consider one that's specific to PICs. That might be an option to get them information in a timely manner.
Okay, that's a good idea.
Thank you.
Thank you. Any other comments from board members? All right, seeing none, Ms. Moderator, would you please open up our Q&A?
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, this is the moderator, and I have one request for public comment. Individual identified as Rachel Stone. Rachel, you'll be given 2 minutes to speak and a 10-second warning. I am requesting to unmute your microphone now.
Wondering if the committee could provide any information in regards to, was there discussion restricting new practitioners from becoming PICs? I guess this is sort of related to the question about requiring a certain number of hours, but I'm just wondering, is there a requirement, or was there discussion on if someone was just newly licensed and they were offered a PIP, they just graduated from pharmacy school, they just got licensed, and a month later they get offered a position as a PIC? Was there discussion?
Yeah, Rachel, thank you for your comment. We did discuss that, and we felt like if the person did the training class, signed the attestation, which we think doesn't happen today, that they would be coming in fully aware. I think we all had situations where new people came in, were great PICs, and in situations where new people came in and that was kind of the job open. So we did discuss that a little bit, but we did not feel like it was appropriate to say you have to have so many hours before you can become a PIC, because there were individuals that that had become good PICs and because of their training prior.
I see. Thank you.
Thank you for your comment.
All right, this is the moderator, and that appears to be our only comment. Would you like me to close the Q&A panel?
Yes, please, Ms. Moderator.
Okay, we are gonna take a vote. Ready for the vote, Debbie? Is that okay?
That'd be great. Thank you.
All right, thank you. Okay, we're gonna start with Maria Serpa. Thank you, Maria. Jake Patel. Thank you, Jake. Cheryl Butler.
Yes.
Thank you, Cheryl. Ricardo Sanchez.
Yes.
Thank you, Ricardo. Nicole Tebow. Thank you, Nicole. Debbie Veal.
Yes.
Thank you, Debbie. Jason Wise. Thank you, Jason. And I vote yes, the motion passes. Back to you, Debbie.
Thank you. Our next agenda item, which is agenda item C, discussion and consideration of implementation plan for listening sessions and pharmacy technician summit. So specifically, at our meeting in July, we decided that we did want to reopen the kind of the information around looking at what a pharmacy technician's job should be. And we've spent a couple years actually doing this, but we felt like at this point in time, enough things had changed that we needed to kind of take a fresh breath of air and hear what stakeholders, technicians, pharmacists had to say. In July, if you recall, things were a little bit different, and we were thinking that possibly by even this fall, we were potentially going to be able to have in-person meetings, and that we were anticipating having a couple in-person meetings where we could receive this information. So with the situation of Delta causing us to continue to have WebEx type meetings, I actually reached out to the executive officer, and we kind of came up with a plan that we presented to the committee that was, for the most part, embraced, and we're going to have a motion to get some guidance from the board. But so the thought was that we have listening sessions. So we were always going to have listening sessions, but they're going to be in person, but they're going to also only be like a couple, one in Northern California, one in Southern California, maybe one in Central California. So we decided to take advantage of the WebEx and have a larger number of listening sessions with a potential of maybe 10 listening sessions. And the goal of these listening sessions is to have kind of a set questions that we would have people participate and provide feedback, so that it would provide us some guidance on where we should go with looking at our pharmacy technician, and ultimately what we give us some information from when we have our potential pharmacy technician summit. It also might actually even help us decide how we do that summit and all that kind of stuff. So what was proposed is where we had landed is having I think like 6 listening sessions specifically for technicians throughout, well, you wouldn't have to have it throughout the state, at various different times of day on the weekend, and probably limited to like maybe 50 people at each listening session, so that we could make sure that we had an opportunity for anybody who wanted to speak to the to the questions. And then also to kind of guide the information that we would collect is that we would put together some questions. The questions would be a little bit different, we decided, for pharmacists versus technicians, although some of them are very similar. And once again, use this information to then develop our next step, which would be, what do we want to recommend? How do, where do we have a technician summit? How do we do it? So the listening sessions were kind of step 1. So with all of that, I don't know, moderator, if you can put up the motion that the committee came up with. So the committee would like to recommend to the board to allow the convening of listening sessions via WebEx and providing an equal number of sessions for pharmacy technicians and pharmacists with questions intended for each audience. Grant authority to the chair and the executive officer to schedule the sessions accordingly. And our goal is we would do it after the holidays, so most likely they would occur in January. But we kind of would like the board to agree that this is a good next step for us to take to address the pharmacy technician, to get information about what we need to do with the pharmacy technicians. So committee members, is there anything else you'd like to add? Board members, do you have any questions or thoughts, comments? Moderator, will you please open the Q&A if we have any public comment?
Sure, at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, thank you. Mr. President, would you like to call for the vote?
Yes, please. Thank you, Chair Debbie. We're going to go for vote for the listening session item for committee recommendation. Maria? Thank you, Maria. Jake Patel? Thank you, Jake. Cheryl Butler?
Yes.
Thank you, Cheryl. Ricardo Sanchez?
Yes.
Thank you, Ricardo. Nicole Tebow?
Yes.
Thank you, Nicole. Debbie Beal?
Yes.
Thank you, Debbie. Jason Wise? Thank you, Jason. And I vote yes, the motion passes. Back to you, Chair Beal.
Thank you. So agenda item D is just review and discussion of licensing statistics. I will assume that you've just poured over those license statistics that are in attachment 2 so far for fiscal year 2021 and 22. I want to make sure you understand it reflects the time that the data does show the time applicant or deficiency responses received through the time it's reviewed by the staff. The standard performance processing time is within 30 days for initial application, within 10 days for deficient. Reviewing the items within the 1 to 5 days that it's specified. So unfortunately, our processing times are in some cases outside of where we like them to be. And our licensing unit continues to struggle with vacancies. We are recruiting staff, and we've unfortunately had some unexpected leave. The managers within this unit are working to try to prioritize work as best they can. And it's always working, and it's hoped that our anticipated processing times will improve as vacancies are filled and our staff returns from their unexpected leaves. And we do shift people around to try to deal with the hot buttons as best we can. But I do want to highlight some of the action taken to try to reduce deficiencies in applications, pointing out that 50% of our pharmacy technician applications are received deficient. So the board has updated both the application and the instruction sheets over the last several years, even made a video to try to address the deficiencies that we see when we receive pharmacy technician applications. Unfortunately, we still continue to get deficient pharmacy technician applications. And just for your knowledge, the most common issues are the applicant submits, they have to provide a self-query. And one of the rules of the self-query is that it has to be sealed. And obviously their name has to be correct on it. So if there's a problem with the way that the name is set up, that could cause a problem, or if it's not sealed, that could cause a problem. Affidavits of completed coursework are not complete, or they're not done correctly, or information's missing, high school transcripts aren't received, or some other documentation that's required is not provided. And then the other one that we kind of focused on was pharmacies. And with pharmacies, there's also a range of issues, with the most common being inconsistent information being provided through the application and supporting material, forms not completed correctly, ownership information not disclosed, complete financial information not provided, and non-resident pharmacies many times don't have compliant patient-centered labels. Some of the pharmacy issues, it seems like they kind of wait for us to ask for the information. So, maybe ownership information, it's not all there. It's almost like the pharmacy application comes in, it's almost like some of these things are waiting for us to ask for. So they're just kind of almost setting themselves up to be deficient. Although our resources are stretched, the staff is piloting a process to schedule phone calls with authorized contacts for some of these applications, specifically I think around the pharmacies, to discuss their deficiencies and ensure that there's an understanding of the requirements and also the requested items that we're going to need to fulfill the requirement. It is a new procedure, and we think as vacancies are filled, that will also help with the applications and reduce the overall processing time. So anyway, we wanted to acknowledge as a committee that we know that although our staff is working very hard, that there are challenges with processing times, and we do all hear it, I think, as board members. So it's a challenge, and as a committee, we're constantly trying to figure out how we can fix it. Is there any other comments from this committee or board members about licensing statistics and or specifically the processing time items I just reviewed? Hearing none, Ms. Moderator, would you please open the Q&A?
Moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I will go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, this is the moderator. It appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. We've got a very quiet group today. So the last item is just to make sure that you know about our future committee meeting dates, January 19th, April 19th, July 18th, and October 18th, all in the year 2022. This does not include our listing sessions that I talked about earlier, as well as I'm sure there's going to be a technician summit at some point in the next number of months. So with that, Mr. President, I will turn the meeting back to you.
Thank you so much, Debbie. And thank you all the committee members and you, Chair, for the hard work and all the time you spent. Okay, so next item is agenda item 7, Communication and Public Education Committee. I will turn the floor over to Ricardo Sanchez, Chairperson for the Communication and Public Education Committee. to provide a report on behalf of the committee. Ricardo?
Good afternoon, everyone. The Communication and Public Education Committee meeting that was scheduled for this morning was canceled for lack of a quorum. So instead, we will present the committee's report for the full board's consideration and discussion. Our first item in agenda is item number A, which is the discussion and consideration of recommended changes to the notice to the consumer's poster display and suggested revisions to California Code of Regulations, Division 7, Title 16, Section 1707.6. Members, the relevant law and background on this item are provided in the meeting materials. A copy of the current notice of consumer's poster is in attachment 1. Today, we are presenting proposed language to modify CCR 1707.6. The language was drafted by staff based on direction from the board at the July 28 board meeting. CCR 1707.6 provides the text for the notice to consumers. The regulation also requires pharmacies to provide a separate notice regarding availability of interpreter services. This is commonly known as the point to your language notice. The proposed language to modify CCR 1707.6, again, is on attachment 1. Key changes include subsection A would require pharmacies to place the notice to consumers in places that are conspicuous and physically accessible so consumers can scan or QR code to obtain a translation of the notice. Subsection B would require the notice to include a QR code that links consumers to a translation of the notice in the top 16 languages spoken by Californians with limited English proficiency, as determined by the U.S. Department of Health and Human Services and the California Department of Healthcare Services. Subsection C would require the point to your language notice to be printed in the top 16 languages required in subsection B. This would bring the regulation in line with current Medi-Cal requirements. Lastly, the proposed language would add a subsection D requiring pharmacies to either post or provide on the patient's written receipt a statement describing patients' rights per Business and Profession Code 733 and Business and Profession Code 4122. Staff has also identified questions that may be appropriate for discussion and consideration as we consider the proposed language to modify CCR 1707.6. The proposed language could require posting the notice in more than one location in a pharmacy, including, for example, a drive-through window. Staff believes this would be consistent with a policy goal of ensuring consumers have access to the notice information. Is this language appropriate? The language also could require posting the notice at automated drug delivery systems, ADDS. Should the notice be required for ADDS devices? These are questions that we can post. The language does not specify how to advise consumers to use the QR code. One option is to print translations available next to the QR code. Another is to list taglines for the 16 different languages next to QR code. Is either option appropriate, or should staff consider something else? Again, these are things that we could discuss. The language requires the point to your language notice to have taglines printed in the top 16 languages, which is consistent with Medi-Cal requirements. The Federal Affordable Care Act, or ACA, requires the top 15 languages. Should the regulation adopt the Medi-Cal standard, the ACA standard, or something else?
Should the language standard also apply to translations of the notice to consumers? Following our discussion and public comments, the board could consider a motion to initiate rulemaking based on the proposed language or provide other direction to staff. Are there any board member comments? And keep in mind, at our last board meeting, we instructed staff to, give us research this and get back to us, and this is what they're providing. So are there any board member comments? Okay, hearing none. Thank you. Members, let's see if there's any public comments. Moderator, can you open up the lines?
I apologize. Was Debbie Veal trying to speak before we went to public comment?
I did not hear her. Was she?
I started to say, I was just kind of looking through the 4 questions, and you have 4 very, good questions here.
Yeah.
I mean, I think we kind of, so should we require a posting of the notice at a drive-through window? I think the answer would be yes. And should, number 2, as drafted, the proposed language could require a posting notice at automatic drug delivery systems. Maybe. I'm kind of trying to work my way through number 3. That's why I was doing the thing.
Yeah, I was gonna say I would have heard you.
That's I think that's hard.
They're the staff is doing a fabulous job.
Yeah.
They're coming back and they're giving us what we've asked for and then some. And it's I love that because it gives us more items to look at and more things to consider here, especially when we're dealing with the public.
Yeah.
So they made some great suggestions here.
Yeah, I think 3 is the hardest one because I'm not, you don't want to, another piece of paper. I'm not sure you want another piece of paper. So they look at that and then they, do the QR code, but it might not work. As far as number 4, 15 or 16 languages, I would probably go towards the Medi-Cal 16. That seems to make sense for our population, but.
Yeah, okay. Let's see. Go ahead.
Sorry, this is Anne. I apologize for the interruption. So I think if I may just respond to Ms. Beal's comment with respect to question 3, I don't think that the intention is to have another thing. I believe the intention is to have the QR code incorporated into the notice to consumers, and then using that QR code, it would take then the consumer to the notice and they can select the language that they would like to view it in. So the question I think is, with the QR code, do you want to have the tagline of each of the different languages so that they understand the different languages that are available, or just putting in translation next to it so that a consumer would understand the QR code is taking them to the different translations? I think that's the decision point. I don't think it was intended to be a separate notice. Hope that was helpful. Sorry for
that was helpful, Anne, but I have a question. So you would print translation available next to the QR code in English, and is it thought that most people who maybe are not English speakers would know those words and go to the QR code?
If Sheila is available, I may kind of punt to her. I think that we were offering 2 different solutions. I'm not quite certain that individuals would know translation available, but I think that was one of the 2 options that we came up with. Tagline is definitely another option that may just address that issue altogether.
So what do you mean by tagline?
So
yes.
This is Sheila. I'm not sure if I can be heard.
Yeah, we can hear you.
Oh, good.
Hear you.
Good. So the tagline is this industry-specific term used for translation services. And it's actually, if you look on the Federal Health and Human Services website, it gives an example of a tagline. So they can be done in a couple different ways. You might recognize these from when you get your explanation of benefits from your health plan. At the bottom, you'll see the actual language symbols, down at the bottom, 16 different or plus more, 16 plus more languages in that actual language to show what translations are available. So the discussion was, did you want to have the QR code on the notice, and then somewhere on the notice, a list of the 15 or 16 languages in the actual language? So for example, Chinese would be printed in Chinese. It's very, very small. It usually takes up 1 to 2 lines. The font is small, but it helps people recognize, oh, my language is, that's my language, and I can get a translation.
I always wondered, what does it say?
Oh,
I know exactly, Sheila, what you're talking about. I see that. I always wonder, I wonder what that says.
Yeah,
so does it say, look at the QR code, or what does it do?
So that's on a piece of paper. So the QR code, so if a person recognized, for example, say they spoke Chinese.
I'm asking, what is it, like when you have all those languages, like you see Chinese, you see Spanish, but what's it actually say?
Oh, it says Chinese.
Oh, okay.
In Chinese, yeah.
Okay. Okay.
So, or Tagalog is in Tagalog, or Spanish is in Spanish. And you can see that sometimes on websites. You can click on a language and it'll then take you to a translation in that language.
Okay.
So
we're just trying
a common way to do it is to list the 16 languages. But the concern on that was it takes up space.
So sounds like a good thing to do, though, to me.
Yeah.
This is Cheryl.
Yeah, good, Cheryl.
I'll comment too.
Go ahead, Maria.
I think that it might be helpful to put all of these comments together into a motion so that we could just go through it all at once. You asked some really good questions, and I think the answer is yes to all of them. My only comment in addition to that would be that it's implied in the regulations, but maybe it has to do with education, is that the sign posting piece of paper, whatever it is, has to be within arm's length of the patient. I've seen these signs sometimes posted across the room or behind the counter. I can't scan a QR code that far away. So that would be my only comment is, the QR code is great, but then that means that the notification needs to be within arm's length.
Yeah.
Well, actually, if you look at the language that's proposed, it says in conspicuous place, physically accessible, so the consumer can easily read and use a QR code.
So it's going to be accessible.
Yeah, so I did say
it's close enough that they can use the QR code.
I did say that the regulation did include that, but I think we need to include that in the educational materials because that's not how it's being posted now. So this would be a change to the sites they might have to post it someplace else.
Hi, and there's one more thing I want to clarify because in our discussions, in our staff discussions, it could sometimes be confusing because we're talking about two different things. Subsection A is the actual notice to consumers, and then subsection C is a different requirement where there's the point to your language. So I just...
Is a QR code only about, is a QR code in the proposed change to 1707.6 at the beginning here where the new language is about being physically accessible and so they can read it and use a QR code?
So that is, the QR code is for the translation of that particular notice. So you have a poster display for your consumers. Video screen is the assumption. And so the QR code will help that consumer access a translation of that poster. All the requirements in subsection A.
Okay.
Subsection C has always been a different requirement where the pharmacy has to have in a conspicuous place a notice containing the text that somebody can point to their language, and you can have an interpreter services would be provided.
Okay.
So you have translation in A, and C is interpreter services.
Would that potentially be I mean, it doesn't say in here, I'm looking at the language, I don't see QR code in section C.
Right, because we weren't including a QR code in section C.
Okay.
Yeah, they're great recommendations. I mean, great. Maria, did you get your answer? Do you feel comfortable with this?
The answer, but I think that I think you're probably looking for a motion so that we can.
No, well, before we get there,
okay.
Before we get there for the motion, I just want to say thank you to Ann, Bob Davila, and the staff who work on all of this, because we come up with some dandies sometimes. We ask for, get us this, and they do come back and they do fabulous work in getting all our committees our information that we need so we can do these presentations. And I just wanted to let them know that they don't go unnoticed, all their hard work that they do. With that, yeah, I'm looking for a motion to initiate rulemaking based on the proposed language. And excuse me, or provide other direction to staff. I'm sorry, who was trying to talk?
This is Nicole. I wanted to make a comment as well.
Okay, go ahead, Nicole.
Thank you. I just wanted to, I don't know if this came up in the process, and I'm sorry I'm coming into this late in the game. So I don't know if other changes are being made to the poster, the way it looks, things like that. But in practical experience, I find that patients are often very confused as to why the pharmacist is coming to give them a consultation. They don't understand that we are supposed to do it on every new prescription, and they sometimes are a little resistant or hesitant. So I'm really hoping that if we're redesigning it, we can make it really obvious that we do this every time and it's for their benefit. And I'm not sure if maybe the print is bigger or how it's changed, but that seems to have been lost on a lot of patients in the previous version.
Well, we definitely are doing that right now, trying to improve on, educating them and giving them the language that they would feel comfortable with to understand why they need these notices. So, but I thank you for your comment.
Yeah, I guess Nicole, do you see the current poster? I mean, the very first thing says California requires your pharmacist to speak to you with every new prescription.
Yes, and we have it hanging right in front of where all of the patients go, and it's incredibly common that they don't see it. So I don't know if it's because there's too much information on one or exactly what it is, but yeah, I do find in practice that many patients do not understand why we're coming. Maybe the translation will help. I'm excited about that piece of it, but I just want to say from a consumer facing standpoint, I find a lot of people are confused about this piece.
And I see where you're coming from. It just myself also, going in and using pharmacies and so forth. I think we sometimes want to add more information onto our ads, but it can dilute the actual message. So we try to balance everything, and I know we've gone back and forth with our committee and asked staff to help us and so forth. But that effort, Nicole, is being done. I mean, we definitely look at it.
Hey,
great, thank you.
So Roberto, looking at D, every pharmacy shall either post or provide a patient's written receipt, a statement describing their rights. What does that mean? What's that going to look like?
First, did you call me
Roberto? I'm sorry, Ricardo.
I was gonna say, did you call me Roberto? Okay.
Sorry about that.
It's Ricardo.
You can call me Dolores or Betty if you want. That's fine.
Anne, are you on?
Yeah, I'll probably ask Sheila to augment here, but essentially, there are other requirements for notification to patients. And so when the board made its policy decision to really reframe the notice to consumer poster itself on really kind of focusing on medication error reduction strategies and what that looks like, we looked at the other provisions of the statute that need to be complied with. And so this is just kind of reminding pharmacies about those other requirements. And Sheila, please feel free to augment where I got.
So we looked at Business and Professions Code 4122, 733, and I'm looking at my notes, and 4122. So it was all to cover patients' rights. So it's just another way of making sure that the patient receives communication of all of their rights.
I guess, I don't know. So I feel like, there's a lot of stuff on receipts. I'm not sure I ever look. I just don't know if this would have any impact, but.
This is something we've been discussing for a while. I just want to, I mean, obviously we don't need to rush through it, but we've been discussing for a while. So I'm wondering, Sheila, actually, since you're here, is there any way we could give some flexibility so that we could update as we feel like we get some feedback, or is that not possible?
When you say flexibility, do you mean to the language of the proposed regulation?
Right, like the way that the tagline would be, how it would be located, where it would be, if it would list 16 taglines and all that details.
I think you have that flexibility right now because the proposed regulation is sort of a high level in that it says the notice must be translated into the top 16 languages. So it doesn't specify how the poster is supposed to indicate that. Do you see what I mean?
Okay, that's good. I mean, I think we should move forward with some.
Yeah, I was going to say
proposal.
I would say we've already gone around with this one, but everybody brings some good points and stuff. It just we have to either move forward or we'll send it back to staff. But let's be specific with them what we want. It looks good. They're bringing back great stuff for us, and we could always improve on it. If we adopt this, we can always come back. We can tinker with it later if we left something out, or anybody has any suggestions. I'm open for that. We are.
Yes, make a motion.
Okay.
Thank you, Debbie.
So you wait until you hear my motion is first, Song. I move that we move forward with the changes to 1707.6. Except I'm A, B, C, and not D. And I don't know what other line. I mean, I know we probably have to have some other comments about giving maybe the committee chair and the executive officer the ability to change it. But I'm assuming that this is regulatory change. So does it have to get noticed and everything, Ricardo?
I'm sorry.
Yes.
Is this going to have to get noticed and approved, or if we make these changes to 1707.6? What are the next steps?
We'll go to comment.
Well, would that if Ann could chime in on that, could that be a legal thing? Ann?
Yeah. Board votes to initiate the rulemaking. The specified language that Debbie Veal specified, if that's seconded and, public comment, then we will initiate the rulemaking process. It will go through the typical process, where there's an opportunity for public comment through that 45-day comment period, and then it will go back to the board.
I'll make, I make the proposal that we initiate the rulemaking process, and what do I give the authority to the executive officer to make any non-substantive changes or whatever to the proposed 1707.6 notice to consumers, section A, B, and C.
Okay.
Does anybody want to second that?
And I can second that.
Okay, thank you, Jason.
Actually, could I get some clarification? This is Eileen Debbie. So you don't want to initiate changes to the D, to D?
Well, it looks like D's an addition, and so no, I don't like that. I don't like the change that it looks like D's an addition, and I don't like the addition.
Sheila, maybe you need to talk about this as well, but I thought that that change to D was necessary if we were removing some of the other rights from the consumer poster.
Can we get some clarification there?
The discussion at the last board meeting, I wish I had the minutes handy, and interesting, there was a positive reaction to that addition at the last board meeting. So, because there was a discussion about changing the current content in the poster and taking some things out. And so if we took some of those things out, they needed to be somewhere in accordance with BPC 4122, which was why we added D, so that it could be captured in the written receipt.
All right, I'll Jason, if you're okay, I'll modify to include D, and then, you know, it's got to go through the rulemaking so we can figure it out. But
Yeah, it was part of it.
yeah, I'll say it as presented. Are you okay with that, Jason?
Do you need to know who the second was?
That was
Jason was the second.
Okay.
Yeah, it's Jason.
Okay. We got a first and a second. Can we see if there's any public comments? Moderator, can you please open up the lines?
This is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. Oh, and it looks like we do have a couple individuals who requested public comment. Give me one moment while I find them in the attendee list. Our first individual is Robert Stein. Robert, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now.
There we go. Thank you for allowing me to speak on this. I just have 2 comments with respect to the proposed language. Number one, relying on QR codes gives me great concern because not everybody has a smartphone that has a QR code reader. So, you know, think about the elderly patients that aren't very tech aware coming into a pharmacy and basically being presented with, oh, here are some options, pick your QR code. It doesn't seem to be very consumer friendly from that standpoint. Now, I do note that it also still requires the poster that the patient can point to their respective language. The second comment has to do with the last paragraph on page 1 of the report. And it says, California law requires a pharmacist to speak with you, and then new language, upon your request, every time you get a new prescription and every time you get a new prescription dosage form, strength, or written directions. I would like to suggest that every time you get a new prescription and every time you get a prescription dosage form change, those go first, and then upon your request is basically the last thing in that enumerated list. Again, I think it points to the priorities in terms of what the board is trying to get the consumer to understand. Thanks.
Thank you. We'll go to the next one.
Next individual is Stephen Gray. Stephen, you'll be given 2 minutes to speak and a 10-second warning. I'm requesting to unmute your microphone now.
Thank you
Great,
again.
you are unmuted.
Thank you. I agree with Dr. Stein in that the language of that paragraph on page 1, the last paragraph, is misleading because it implies that it's only upon your request. And it even implies that if you're not very careful by putting it at the end. So it would be new prescription every time you get a new prescription, and then it should say something like, and anytime upon your request. So to make sure, because that's what the law says. The law explicitly says that regardless of whether you get a new prescription, regardless of whether you have a change, a consultation is required anytime the patient makes a request. So that needs to be very clear. Also down on the second page, third bullet down, talks about before you leave the pharmacy, check. The third bullet down says the name of the medicine and what it does. There was a lot of research done at the time we adopted the patient-centered prescription label. And instead of saying what it does, it should say, and the purpose of the medication. That was supported by a lot of research. And we don't, I've shared this with other pharmacists and I've said, what does that mean? And they say, well, that could be confused with what it does. You're asking about, side effects or other possible reactions to the drug. What we really want to emphasize is that the patient know what the purpose of the medication is. If you want to take that down a level, then in practice, what we put on there is what the medication is for. What the medication is for, even though you're ending a sentence with a preposition. So I would say use the purpose of the medication. That's very important.
10 seconds.
Across. Thank you.
All right, we'll move on to our next individual who has requested public comment. Paige Talley. One moment while I refresh my attendee list. There we go. You'll be given 2 minutes to speak and a 10-second warning. I am requesting to unmute your microphone now. All right, you are unmuted.
With the California Council for the Advancement of Pharmacy. And on question number 2, I think that it requires more definition. Their ADDS covers both the patient dispensing machines as well as the automated unit dose systems, which are not accessed by the patients. So I would recommend that you put APDS rather than ADDS, because I think you're only referring, skilled nursing patients do not access their machines, and I don't believe the hospitals do either, and they have ADDSs. Maria, Dr. Serpa could correct me if I'm wrong, but so my comment is that you be more definitive on what kind of dispensing system you're referring to. Thank you.
All right, this is the moderator. We'll move on to our next individual who has requested public comment. Keith Yoshizuka. Keith, I will request to unmute your microphone now. You have 2 minutes and a 10-second warning. All right, and you are unmuted.
Thank you very much for the opportunity. I agree with my colleague, Dr. Stein, regarding the QR codes. I would advocate for some redundancy in making sure that the message gets across. If it's exclusively QR code, I feel that it might be discriminatory against the underprivileged and basically medically indigent who don't have a smartphone, and also the elderly, like my mother, who has a smartphone, but the only thing she knows how to do is answer calls. She can't dial, she can't receive text messages, she wouldn't know what to do, definitely not using it to scan a QR code. So I'm saying I'm not saying not to use it, but also have other languages so that you're not relying solely on the fact that people have access to the technology. Thank you.
All right, this is the moderator, and that appears to be our last request for public comment. Would you like me to close the Q&A panel?
Yes, please.
So, listening.
I was going to say, is it closed, moderator?
Oh, I apologize. Yes, the Q&A panel is closed.
Okay, just waiting for your prompt there. Okay, go ahead.
I was just going to say, listening to the comments, I feel like the way this is written, the QR code is an option. I mean, it could be on, it will be on the poster or whatever, or video, but the rest, but there is still a message there. So the QR code is only kind of an add-on. But what a couple people said, and Jason, let me know if you agree. I could see at the bottom of page 1, maybe changing the wording on that, because I understand their comment. California law requires a pharmacist to speak with you every time you get a new prescription, and every time you get a new prescription dosage form, strength, or written directions, and upon your request. So maybe, I don't know, maybe we just put upon your request kind of at the end. And I do agree with also what Dr. Gray said, the name of the medication. If you look at 4706, it does say purpose is what we put in the patient-centered label stuff. So that might be the name of the medication and its purpose or something like that. But I don't know if those are non-substantive changes that we could just delegate to the executive officer to do.
Yeah, I can see the changes there, and I know the QR codes. That's, to me, I understand what Dr. Robertstein's suggesting, and with technology, but technology is here, and we have to have a balance here with those who do use the smartphones, and also be considerate for those who don't have access to one. But that has to be a balance there. Anyways, any other suggestions or comments from our board members?
Hi, Ricardo. This is Jason. If I could just get confirmation from staff that the QR code, I've understood it as in addition to what we're already doing. We've retained the point enter language notice that has always been there, and then also could we leave the outstanding question of the order in which the items on the notice are placed up to the discretion of staff? Is that something that is non-substantive? If I could get an answer for that, Anne?
And Sheila, jump in where I'm wrong here. So with respect to the first question about the QR code, yes, that is correct. The QR code is intended to be in addition to the notice to consumer to provide ready access to the translation of the notice to consumer poster. The point to your language notice will still absolutely be required and available, and that is under section C of the proposed language. With respect to whether or not reordering the language would be non-substantive, I think because it's just reordering, my sense of it is that it would be non-substantive, but I would totally defer to council on that.
And what about even changing like what it does to its purpose? Is that would be non-substantive, wouldn't it be? On the poster.
So I'm like, to me, it seems like it, but I would also, again, defer to council.
Eileen, can you help us?
Sure. I think with respect to the order, I think if the board deems it to be non-substantive, I think the content really becomes substantive. So for the ordering, I think that we could leave, or we can fix the last paragraph if that's what the moving party and the second wants us to do, because I can see the point about making it clear that there is no, upon your request in certain circumstances, the pharmacist has to talk to you. As for whether we substitute what it does for the purpose or some other wording, I think that could be non-substantive. And if you wanted to change your motion, you could delegate for the executive officer to work with somebody on the either the chair of the committee or somebody else on the board to work through those type of non-substantive changes.
Thank you, Eileen. I think Eileen described it perfectly as to what needs to take place. So I do agree that the moving upon your request seems more like a substantive change based on this discussion. And so you can direct staff and executive officer to make that change, as well as make the change for the name of the medicine and what it does, and changing that to the purpose of the medication.
Jason, what do you think? Should we update our motion to change the sentence at the bottom of page 1 and then add purpose to the third bullet point?
Amenable to that. So if you could wrap this up with a bow, just so we get something on the table that, yes, I think that giving staff discretion sounds like a good idea, and the return to the phrasing of purpose, I would also be in support.
Okay.
And
Yes, so
Debbie, is your motion going to be then to approve the amended or the language, the changes to 1707.6 with the changes that's just outlined above? And are you going to delegate it to the executive officer to work with any particular member of the board?
yes, it can, yeah. How about do we want, I mean, usually it's the committee chair. So that's probably what I would do. You okay with that, Jason?
I would
chair?
second.
And then because we have an updated motion, we should put it out for public comment, but first check to make sure no other board members got other comments.
Any other comments from board members?
Yes, this is Cheryl Butler, and I'm just agreeing with the purpose that Stephen Gray spoke of, and so I like where we are with this at this point. Okay. Thank you.
Okay.
This is Anne. I apologize for the interruption. Can I just confirm the motion is to initiate the rulemaking to amend 1707.6 as presented with the additional changes identified, authorize the EU to make non-substantive changes and work with the committee chair to finalize the language prior to initiation of the rulemaking? Do I have that correct?
Yes, but well, maybe. So, I mean, if we think, I mean, I kind of heard two opinions on the sentence at the bottom of page 1. I mean, you understand where I think we want to happen to that sentence? If you can do that with that motion, then that's fine. If we need to change that sentence, then I will change it.
So would you prefer that I update the motion to initiate the rulemaking to amend 1707.6 as presented with changes identified, including the rewording of paragraph 1, as well as the third bullet related to the purpose of the medication? You want me to add that into the motion? Okay.
Yes, please. You okay with that, Jason?
Okay, do we have to go back to public?
Yes, we do, because we have a new motion.
Okay, with the new motion, can we open it up for public comment now?
At the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please.
All right, the Q&A panel is now closed.
Okay, now we're back. Let's see. Well, I think we need a vote now. So, yeah.
Thank you, Ricardo. Okay, so we got the motion and we're gonna go for a vote. And so start with Maria. Thank you, Maria. Jake Patel.
Yes.
Thank you, Jake. Cheryl Butler.
Yes.
Thank you, Cheryl. Ricardo.
Oops, yes.
I assume yes. Nicole Tebow. Thank you, Nicole. Debbie Beal.
Yes.
Thank you, Debbie. Jason Wise.
Yes.
Thank you, Jason. And I vote yes, the motion passes. Back to you, Ricardo.
Okay, thank you. Let's move on to item B now, which is update on communication and public education activity by staff. The script, the current issue of the script was published in September and is available on the board's website. The next issue would include an annual update on new pharmacy laws and is expected to be published in early 2022. And move on to number 2, staff outreach. Board inspectors and staff provided continuing education training via WebEx for about 400 pharmacists on prescription drug abuse and diversion on August 11th, 2021. In addition, Executive Officer Ann served as a panelist at 2 events for pharmacists listed in meeting materials. News media. Staff responded to news media inquiries since the last committee meeting that are listed in attachment 2. Conversation of self-assessment process to online. Staff is continuing to research a possible online interactive option for the board's self-assessment forms. Staff has reached out to DCA's Office of Information Services, OIS, to discuss creating a process that would enable licensees to complete and sign the form online and also would provide verification to the board that the self-assessment was performed. This concludes the items in this section. Any member comments? Hearing none, moderator, can you open it up for public comment?
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you had a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please.
All right, the Q&A panel is now closed.
Thank you. I just wanted to first, lastly, want to thank our board members for your participation in making this poster a lot better, and with all your recommendations, and also the staff who has worked diligently on this and has gotten us back some great suggestions and guidance here. This concludes the report from the Communication and Public Education Committee. Thank you very much. That'll be it.
Thank you so much, Ricardo. All right, so we're moving on to agenda item 8. It's gonna be quick. So Legislation and Regulation Committee report. The next committee is Legislation and Regulation Committee. The committee did not meet this quarter. As the chair of the committee, I will be providing the report. Regulations report. Members, as detailed in the meeting materials and associated attachments, the board has a number of regulations in various stages of promulgation. I do not intend to review each as the information is contained in the public materials. I do note that the board currently has 1 regulation undergoing final review by the Office of Administrative Law and 1 regulation undergoing final review by the DCA. The board also has 3 regulations undergoing pre-notice review. Members, do you have any questions or comments on any of the regulations included? Okay, moderator, please open the lines for public comment on any of the regulation items listed.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. All right, that's it for Legislation and Regulation Committee. Moving on to the next agenda item 9, Organizational Development Committee report. I will now provide an update on several items under the purview of the Organizational Development Committee. First, the budget. The board spending authorization for the current fiscal year is $29.6 million, which is a 1.3% increase from the prior year. Also included in the meeting materials is information on the prior year's budget. The prior year spending authorization was $29.3 million. Based on final budget reports, the board received $34.4 million in revenue and expended $27.7 million. The largest sources of revenue and expenditure are provided in the meeting materials. A review of the fund condition prepared by the department indicates that at the end of the current fiscal year, it is projected the board will have 4 months in reserve. As indicated in the meeting materials, under provisions of pharmacy law, the board shall seek to maintain a reserve equal to approximately 1 year's operating expenditures. We will continue to closely monitor our fund as projections indicate a slow depletion of the fund rather than moving to approach the 1-year reserve called for in the law. Any questions on the budget report, members? Okay, moderator, please open the line for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. Okay, the next item is board member attendance and mail vote information. Member attendance is summarized in attachment 2, and attachment 3 includes mail vote information. Members, any comments? Moderator, please open the line for public comment.
This is the moderator, and at the direction of the board, I have opened up the Q&A panel for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. Okay, so the next item is personnel update. As detailed in the meeting materials, the board has a number of vacancies, including several leadership and senior management positions. Recruitment for many of these positions is delayed because of budget concerns. I'm working closely with Anne on this issue. Next is strategic plan update. Thank you again for your participation in the strategic planning process last month. As you may recall, during our planning session, no changes were made to the board's mission, vision, and value. Improve the strategic objectives for each of the respective goal areas. I will be working with staff to finalize the language and action plans will be developed. And finally, meeting calendar for 2021 and 2022. Attachment 4 includes the meeting calendar for the remainder of 2021 and 2022. Thank you so much again to everyone for your continued commitment to the board. Members, any comments? And any moderator, please open the line for public comment.
All right, this is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on these items, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. All right, so next agenda item is agenda item 10, discussion and consideration of adoption of board-approved regulation, Title 16, California Code of Regulations, Section 1704, address change notification. Members, next for our consideration is adoption of the board's regulation, Section 1704, related to address change notification. I trust you had an opportunity to review the meeting materials. The materials include a proposed text release for the 45-day comment period, the comments received during the comment period, and the staff prepared summarized comments and staff recommendations. I do agree with staff recommendation and would appreciate member comments. I would also appreciate or entertain a motion to adopt the regulation if agreeable. I note the meeting materials include possible adoption language. Members, any comments or anyone willing to make a motion? Thank you, Debbie. Go for it.
To accept the board staff recommended comment responses and adopt the regulation language as noticed for the 45-day comment on September 23rd, 2021. Additionally, delegate to the executive officer the authority to make technical or non-substantive changes as may be required by the control agency to complete the rulemaking file.
Perfect. Thank you so much. Anyone willing to second?
This is Maria. I'll second.
Thank you, Maria. Maria seconds. Okay. And any other member comments? Okay. Moderator with a motion on the floor, please open the line for public comment.
During at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. Go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you so much. All right, with a motion and second and public comment, we will call for the vote. Maria?
Yes.
Thank you, Maria. Jake Patel? Thank you, Jake. Cheryl Butler?
Yes.
Thank you, Cheryl. Ricardo Sanchez?
Yes.
Thank you, Ricardo. Nicole Tebow? Thank you, Nicole. Debbie Veal?
Yes.
Thank you, Debbie. Jason Wise? Thank you, Jason, and I vote yes, the motion passes. Okay, the next agenda item for the day is Executive Officer Report. I will now ask Anne to provide a brief report. Anne, floor is yours.
Thank you. So a lot of the information is detailed in the chair report, so I'll keep my comments pretty short. One of the things with respect to the COVID responses, I would like to let members know, as indicated in the chair report, we have streamlined how we are providing the COVID related information to allow, to ensure that licensees have ready access to other information as well. So we have centralized the COVID information, but it's no longer on the homepage, but there's a ready link to it on there. Director continues to have some waivers. They are also allowing waivers, some waivers to expire, similar to the actions that our board is taking. There is a summary of the various waivers that are still in effect that have broad application, including the recent amended and reissued waiver that speaks to pharmacist interns providing vaccination services. It was recently amended and reissued to also allow for interprofessional supervision. So that is the link to that is provided in the meeting materials. There's also data included in the report specific to the site-specific waivers that we have been issuing, as well as the temporary licenses that were issued. And we kind of discussed some of that earlier when we were discussing provisions of AB 1533. With respect to operational changes, we have transitioned to a more deliberate telework model, which seems to be working very well, and we look forward to additional guidance from the administration. Transitioning to the NAPLEX, just for transparency, wanted to let members know that the NAPLEX fee will be increasing to $820 as indicated in the meeting materials. Wanted to also remind members that are interested in providing feedback to the ACPE standards that that survey is still open through the end of the year for any members that would like to participate in the survey. Also included in the meeting materials, as well as posted separately in the dedicated area on our website, are the passing scores for the CPJE and the NAPLEX for the most recent reporting period. And then finally, I've also detailed out what our communication plan is with respect to releasing the new detailed content outline and how we intend to reach out to stakeholders. So I did include kind of what our communication plan is in the chair report as well. So I think I'll keep it very brief if that's okay, President No, and I'll turn it back to you. Thank you so much.
Thank you so much, Anne. And members, any comments or questions for Anne?
A quick question.
Thank you. Go ahead, Maria.
Anne, I'm not sure if you're aware of a comment that I heard out in the community about the NAPLEX exam and communicating results back to people who've taken the NAPLEX exam. Have you heard of any issues in the last few months with them having problems?
There was an issue, Maria, for a 2-week period of time where there were some candidates that did not receive the correct scores. That was later corrected by NAPLEX. We did, at the request of the deans, we did provide a little bit of information to them as well regarding it, but it was a system issue with NABP, and they have put some additional controls in place, Maria, in the hopes that that issue is not repeated again. But there were about 22, I believe 22, maybe 24 individuals that were taking the NAPLEX as part of California that were impacted by that.
And the impact was either way, they either had a false failure or a false pass, or was it one or the other?
It was either one. And for those that received initially a false fail, if you will, those we expedited the ILFs as soon as we received the payment so that they could get their pharmacist licenses. I believe that there were 2 individuals that were initially advised that they passed when in fact they had failed.
Thank you.
Thank you, Maria. Any other member comments? Okay, so that is it. As indicated on the agenda, we're going to move on to agenda item 12. We're going to go to closed session. The board will now move into closed session for the stated purposes.
Excuse me.
Oh, go ahead, Maria.
Is there public comment on Anne's report?
Oh, sorry. Yeah, we're going to do public comment for Anne. Sorry. Good. Thank you, Maria.
This is the moderator. At the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you so much. And thank you, Maria. And so then we're going to go to the closed session. As indicated on the agenda, the board will now move into the closed session for the stated purposes indicated on the agenda. Due to technological limitations, adjournment for the day will not be broadcast. Adjournment for the day will immediately follow closed session, and there will be no other items of business discussed. Members of the public, thank you for joining the meeting today. We will reconvene tomorrow morning at 9 a.m. Members, we will begin closed session in 15 minutes. So we will see you at 4:25. Thank you, everyone.